get started in just a few minutes. Let me just load these videos up and then we'll get started. Good morning. Okay, we're ready to get started. Good morning, everyone. Good morning. Everybody have a good Mother's Day. I've lost a pen. There it is. Okay, so over the weekend, you guys had chapters 5 and 6 to do. Any questions on those? Any questions? Do you remember talking about our body as a factory and how each part of our body ages? So when we have an aging individual, some short-term memory loss is actually pretty common because the factory that makes those memories maybe isn't working all that great today. So they can't remember what they had for lunch or where they put their keys or why they walked into a room, right? It's just because that part of the brain just isn't really working to peak efficiency today. And that's okay. That's normal for aging. Alzheimer's is a little bit different. Alzheimer's and other forms of dementia are more diffuse in their presentations. So with Alzheimer's, it's processing, not memory making, it's processing that tends to be affected. So if you think of your memories kind of like a big web. So when you have a memory, let's say of this room, okay, so 50 years from now, you think back to CNA training, your brain is going to conjure up some form of this room. Now it might be a whole bunch of colors, you might see a whole bunch of colors and trigger that memory. Because we're very colorful in here with all of our banners and stuff. It might be black scrubs because that's what you wore to class. It might be cold. You might get cold in 50 years and all of a sudden remember class because you're always cold in here. It might be, I don't know, big TVs. Like all of these things make up your memory, all of your senses. What you see, smell, feel, hear, all of that's going to contribute to the memory. So you have to think of memories like big webs with lots of different connection points, because this isn't the only time you'll wear black scrubs. And it's not the only time you're going to see lots of colors. And it's not the only time you're going to get cold. So all of those things are going to intersect with other memories as well. Make sense? So think of it like a big 3D web of memories, and things that have common points will all bring up other memories. Well, when we have Alzheimer's, those points are still there. What breaks are the connections to those points. So you might have a memory of your daughter when she was very young, but you have no other memories of her as she grows because those connections are missing. So if she comes in to visit and she's in her 60s, you may not recognize her because those connections are broken. But you see her granddaughter and you think that's her because that's the only connection that your brain can make. Does that make sense? Okay, so the memories might be there, but the way of accessing them is broken. Now, this becomes challenging because as Alzheimer's progresses, more and more connections get affected. And some of the connections that get affected are things like that we do every day, things like eating, recognizing hunger, recognizing safety, being able to walk. Those are all things that are going to be lost because the connections to get there are just not there anymore. But they might wake up on Tuesday and that connection is working today. So Alzheimer's can be very challenging because it's not completely linear. It's not, you start to have Alzheimer's, you go to this step, this step, this step, this step, and you're done. It doesn't work like that. It's very nebulous. So when we're working with Alzheimer's patients, we have to use a lot of patience. You don't want to say things like, don't you remember, this is your daughter. She was just here yesterday. Why can't you remember this? That's not how we want to approach this. No, they can't remember it. That connection is gone. That road has washed out. They can't get there. So don't be frustrated with your patients. Use a lot of patience. We're going to have to remind them of things quite often, things that you wouldn't think you'd have to remind somebody about. Like, Mary, you need to eat. Let's sit here. Let me show you how to sit. This is a chair. This is a chair. Mary, we sit in the chair. We sit. Oh, that's comfortable. Do you want to try that? Come here. Come on and try that. Let's sit here. Oh, you're sitting. Are you hungry? Let's get you a snack. So we're really going to have to work on convincing our patients to do things that you and I take for granted. Okay. Does that make sense? Now, I want to explain the difference between dementia and Alzheimer's. So if I'm standing here and I tell you, oh my gosh, guys, I am sick today. I'm sick. That tells you I'm not well, but does it really tell you much? No, it just means that I'm not well. But does sick mean my tummy hurts? Does it mean I have a headache? Does it mean I've got a cold? What does that word sick really mean? It could mean a lot of things, right? Well, that's dementia. Dementia, that term just means brain sick. Doesn't really give us much information. I mean, is it dementia because of Alzheimer's? All those connections got mushy and separated. Is it dementia because of you had a lot of small strokes and interrupted the blood supply to different parts of your brain and they just died? That can cause dementia too. Is it just the normal aging process? That makes your brain sick, not working well, right? So that word dementia is very general. It just means something in the brain not quite right, not working at peak efficiency. Alzheimer's is a specific kind of dementia. So if I say I'm sick, that tells you I'm not well. But if I say, oh my gosh, I have got this horrible cold, I'm sneezing and coughing and lethargic and I feel horrible, that gives you more information, right? So remember that dementia is just one kind, Alzheimer's is one kind of dementia. There's lots of different kinds of dementia. There's Jacobson-Crutchfield disease, there's Lewy body dementia, there's Parkinson's dementia, there's multi-infarct dementia, there's Alzheimer's dementia, there's all kinds of reasons to develop a brain sickness. And they're all going to present a little bit differently. Now, with dementia, any kind of dementia, we generally don't give yes and no questions. Because when their brain isn't working right, they're going to try to exert their independence any way they can. Like humans, adult humans, we don't like to be dependent. We want to be independent. So this operates kind of like a 3-year-old. A 3-year-old will tell you no for no reason. They'll just tell you no. You want to put your shoes on? No. You want to go to the park? No. They'll just tell you no. And they're not telling you no because they don't want to do that activity. They're telling you no because it's a way of exerting independence. It's a way of separating themselves. And it's a very important stage, by the way. Don't get mad at your kids for doing that. I know it's frustrating as a parent. I had 4, I know. It's very frustrating as a parent, but it's a very important stage because they have to develop that autonomy. So instead of asking them yes and no questions, give them limited choice questions. If you plan on going to the park, don't ask, do you want to go to the park today? What you want to say is, do you want to go to the park before or after your snack? It gives them an opportunity to make a choice, but you still have control. Does that make sense? So we're going to do that with adult dementia patients as well. I'm not going to ask a dementia patient, do you want a shower? Because you know what they're going to tell me? No. And a lot of that has to do with energy, which we're going to get into today. I've got a big lecture to tell you about energy conservation because this is affected with age. So we're going to talk about that. But a lot of it has to do with energy, but some of it is also because of that need for independence. So I'm not going to ask, do you want to take a shower today? Yeah, they're going to tell me no. What I'm going to say is, would you like your shower before or after breakfast? Or would you like your shower before or after I shower Mrs. Mabel? So I'm going to give them limited choice. Make sense? You get much much better results from your patients, allowing them to make some choices and be part of the process. If I just walk in and say, all right, it's time for your shower, come on, they're going to fight me because that's not giving them any autonomy. So limited choices are important. But the most important technique that you're going to have to master when you're working with dementia patients is distraction and refocusing on something else. That is the best technique for you to be able to master when you're working with patients. Because a lot of times they'll get fixated. And the biggest thing they get fixated on is, I want to go home. I mean, right now, I love you guys, but I want to go home. And you guys probably do too. You want to go home. You're here for a purpose, but yeah, all things considered, you'd rather be home. Right? That doesn't ever end. The more uncomfortable you are home, absolutely. Now, we've plucked this person up, put him in a strange place, surrounded by strange people, probably in a locked unit if they have dementia. Nothing is the same. They don't eat the same foods. They don't go to sleep at the same time. They don't maintain the same schedule. Nobody ever comes and visits them anymore, right? So their whole life has changed. They are completely uncomfortable. What are they going to ask? Where do they want to be? Home. So when do I get to go home? When can I go home? Where is home? I'm ready to go home. They're going to be focused on home, and who can blame them? I would want to go home too. That's not home. That might be where they have to live, but to them, home is something that was in existence 40 years ago. Remember, those connections are mushy. So unless they're in the same house they were in 40 years ago, this is not home, and they're not going to be comfortable, and they're going to want to go there. So a lot of your dementia patients are going to say quite often, can I go home? Or they may even try to do what we call exit seeking strategies. They'll hang out by the doors. They're just waiting for somebody to not be paying attention and slip through. We call that elopement. When somebody leaves the facility without permission, that's eloping, which is completely different from eloping when you're younger. But it just means that you're going somewhere without permission. The best thing to do is not argue with them. You don't want to argue with them. This is where you live now, Mary. You need to be comfortable. This is where you live. Let me show you your room. That doesn't compute. Remember, those connections are mushy. When they think home, they think of where they were 40 years ago. That is not computing. So instead of trying to convince them this is where they live, because you're going to have a fight on your hands. They are not going to accept what you are trying to sell them. They're just not. So instead of getting into all that, redirection becomes your best friend. Okay, Mary, well, we can talk about that in a few minutes, but come over here because there's something I want to show you before you go. Let's go over here. Get them involved in a TV show. Get them involved in a sing-along at the piano. Get them involved in an activity. Redirect, refocus their attention somewhere else. I have two things that I use with dementia patients when I really need a little bit of time, a little break. There's two things, and they work great. With women, specifically, because women of this age were normally homemakers, caregivers, and a lot of them were very familiar with magazines. This is part of their youthful experience. It was very common to flip through a magazine, see all the latest and greatest. Well, all the home magazines have a Snuggle fabric softener ad in them. They do. So I will ask my adult dementia female patients, Miss Mary, I can't find my teddy bear. It's in this book. Can you find the teddy bear for me? Can you find the teddy bear? And give them the magazine and let them flip through. It will buy you 5 minutes of time because they'll flip through it. And this doesn't work for everybody, but most adult women of that generation will flip through a magazine. They may forget what they're looking for halfway through, which is fine. I've bought myself some time. You can also get them to fold washcloths or match socks. Now, a lot of people think, oh, that's slave labor. You can't ask patients to do that. Yes, you can. And you probably should. And this is why. This is something we don't really think about too much. I want to go on vacation. And the reason I want to go on vacation is because I'm tired of doing laundry and cooking and cleaning and all the things I have to do outside of my work environment, right? It's a break, isn't it? We like vacations because it gives us a break. And during that break, I don't have a whole lot of responsibility, and that's wonderful. But at the end of that break, I have to come home and I have to resume my responsibilities because people rely on me. And although I might roll my eyes at the end of vacation and, oh, I wish this could have lasted forever, I really don't want that because people relying on me gives me a sense of purpose. It makes me feel like I'm part of a contributing member of my family. It's good to be needed. It serves a purpose. Now, imagine tomorrow morning you woke up and nobody needed you. Nobody. Nobody's calling on the phone. There's no reason to cook or clean. There's no laundry to be done. Nobody needs you. In fact, nobody really cares if you live or die. Nobody cares. Now, imagine living the rest of your life like that. Somebody's taking care of everything for you. They're cooking, they're cleaning, they're doing laundry, they're doing everything for you. But they also don't care. How long do you think it would take before you got depressed? Yeah. When we put patients in congregate living settings and we take care of everything, it robs them of their sense of purpose. It robs them of their place in the community. And that's the quickest way to depression. When you feel like you no longer matter to society, it will rob you of your will to live. People need to feel a sense of community. They need to feel a sense of belonging. So in a long-term care setting, having people fold washcloths helps them contribute to the community. It's perfectly okay. And it actually gives them a much greater experience, part of the whole. Does that make sense? But only those that are interested, willing. Now, men, we're not going to have you guys fold washcloths or match socks. It's not really part of your normal daily experience, right? We need something a little different for you. Men are much more tactile. So women are more nurturing. This is stereotypical. I know not everybody fits all lines here, but stereotypically, women are more nurturing, men are more tactile. So with the men, what I used to do is I had a shoebox full of rice, raw rice, not mushy cooked rice, raw rice. And I usually got the jasmine one because it smelled really good. Nice soothing smell. And I would put in that box nuts and bolts and washers, or sometimes marbles. And I would hand the box to a man if I needed to buy some time, a man with dementia, and I would say, there's some nuts and bolts in here. They're lost. Can you find them for me? Sometimes I would even say, I've lost my marbles. Can you find them for me? And they'll chuckle if they have that a sense of association. But they're tactile. They'll sort through and find those items, and it will buy you a few minutes to do whatever it is that you need to do with somebody else. So distraction, redirection, engagement in activities is going to be your best friend when working with dementia patients. Does that make sense? Good. What you don't want to do is lecture them. You don't want to try to convince them of something. You're not going to get anywhere. It's just going to be frustrating for both of you. Okay. Good. Make sense? That's what you need to know out of chapter 5. All right. So you had chapters 5 and 6 over the weekend. Let's get your scores. Rochelle? Neve? Thank you. Shakima?
80 and 90. 80 and 90.
90. Okay. James? Vanessa? Thank you. Christopher? Dwayne?
No score.
No score? Okay, that's fine. Just for your own knowledge, I need 2 through 6 at some point. Let's see here. Maya? Vita?
90 and 90.
Okay, do you have 2, 3, and 4 for me?
90 because you missed one.
95 if you missed one. Okay.
And then I missed 2 out of 3.
Okay, and what about 4?
And I missed 1.
Thank you. Lucille?
90 and 90.
Thank you. Asia?
No, I wasn't able to get
That's fine. Shelby? Adam?
I missed 2 on each.
Thank you. And Faith? Okay. All right. Class is half over, guys. You believe that? There's only 3 classes left after today. That's it. It's going quick. So if you have not registered for the test yet, this would be a really good time to do that because you want to test about a week or 2 after class ends. You don't want to be waiting months after class ends. And this is why. I know you guys are all sitting there going, but I'm not ready yet. I'm not ready yet. I don't want to register because I'm not ready yet. You are. You are. I know you need some practice. We're going to get to that. You're going to get some practice time. But you have the knowledge you need to pass the test. You've got to put faith in me right now. I have seen it happen many, many times where students don't register for the test during class, and then they graduate and they get out there and life gets in the way. They think, okay, I'm going to practice after graduation, then I'll register. Well, after graduation, you find everything in the world to do but come in and practice. So you keep putting it off and keep putting it off and keep putting it off. And maybe you don't have the money, or, you know, you've got a vacation coming up, or whatever life throws at you. Well, then 6 months later, you're like, you know, I really have to take that test, but now I can't remember. I can't remember everything that I learned. So then you end up coming back through the class. And that's a huge waste of money and time. You are prepared. Okay, you are. Register for the test. I just heard from 2 more students from the last class, and they both passed. Perfect scores. Trust me, you're ready. Go ahead and register. Okay? Good. All right, remember the game show on the 1st and 3rd Tuesday of each month. So that'll be next Tuesday. I'll remind you, the day before graduation, by the way. I'll remind you of that next Tuesday. But keep this in mind as we get a little bit closer to the end of class. This is going to become a little more important to you. All right, so let's do a quick review. How do we know what to do with each patient? Yeah, we follow the care plan, and it's the whole care plan, and Nothing but the care plan. That means we can't add to it. We can't change it in any way. It stands alone. While we're following that care plan, what else should we be doing? Making observations. And then who do we report those to? The nurse. Every skill starts with the opening. Every opening starts with a knock. Okay, who do we want to greet? By name. What do they need to know about us? Yeah, our name and title, and then we want to describe the skill. Why are we doing that? What do we need from them? Consent or permission. Absolutely. If they don't know who you are, or what you want to do with them, they can't give consent. Does that make sense? All right. Once we've done that, then we can close the. Is that curtain clean? What do we want to do after? Wash your hands. And then you can go get your clean supplies. Absolutely. Our cardinal rule here is don't touch patient until your hands are clean. Very good. Very good. All right. One of the supplies we have to consider is gloves. Remember, we evaluate gloves with every single skill. It's not based on the skill. It's based on the patient. All right. So how do we know when we need gloves? Body fluids, non-intact skin, personal skin. Yeah. So personal skin, non-intact skin, or body fluids. If the answer is yes, you need gloves. If the answer is maybe, you need gloves. The answer is no, you can do fine with hand washing before and after. That's fine. But if we do decide to wear gloves, what is the first thing our gloves should touch? The patient. And then once the gloves have touched the patient, they're contaminated. So we have to pay attention to everything else in the environment that we're touching. And then we have to remove our gloves correctly. How do you remove gloves? Pinch, pull, under pull. Okay, good. All right. If we're going to use supplies, then we probably need a place to put them. Is our table clean? No. So we're going to use something called a barrier. And remember, anything can be a barrier. But that barrier is going to be used to put our clean supplies on. It provides a clean place for our clean supplies. And we can only touch our supplies with what kind of hands? Clean hands. Yeah. What can't those supplies touch? Your uniform. And when do we want to get that barrier? Before or after we get our supplies? Before. So we wash our hands, we get our barrier, put it on the table, get our supplies, and put those on the barrier. Good? All right. Sometimes we need a privacy blanket. How do we know when we need a privacy blanket? Uncovered or undressed, because that blanket is there to keep our patient warm and provide privacy. So when we put the blanket on, should we take the sheet all the way off and then put the blanket on? No, we want to put the blanket on over and pull the sheet down under so the patient is always covered. Good. When you put the blanket on, what can you not do with that blanket? Shake it or snap it. And then at the very end of the skill, when we're ready to take that blanket off, we first have to remove our gloves. Yeah. You don't want those dirty gloves to touch that sheet that's going to go right up next to their face. Good. All right. Linen rules. What can, and we already know all of these are, or most of these are repeats. Linens cannot touch your uniform. What kind of hands do we need to get our linens? Clean. We don't want to do what to our linens? Shake and snap. Now, this next one is a little bit newer. Clean rolls toward me, dirty rolls away. And we don't want our clean or dirty linens to touch the floor. Anything we don't use that we took out of the supply cabinet, what do we do with it? Dirty linen. Very good. Where does the patient need to be at all times in the bed? In the middle. Can we use side rails to keep them there? No, side rails are a restraint, and they require a doctor's order. Yeah, remember that. You will not have side rails in all settings, and you don't need them. So if our patient always has to remain in the middle of the bed and we have to turn them on their side, what do we do first? What do we do first so that after the roll, they're in the middle of the bed? Scoot toward me and then roll away. Good. We remain behind, the patient's behind. Remember that. All bathing is done the same way. What do we not add to the basin? Soap, because we need water for rinsing. Absolutely. Is that faucet clean? So when we're getting water, what do we need to turn the water on? Paper towel. So how do we know the water is the right temperature? We check it with the inside of our wrist. Yeah, wrist. And then who else checks it? The patient. What kind of water should we be using? Hot, cold, warm. All right. Whatever we wash, we rinse. Whatever rinse, we dry. And you want to try to keep your surface from getting wet. So we're going to use a barrier on the table or the floor. We're going to use a towel if we're washing something on the bed. You want to try to keep your surface from getting wet. And if we're going to put lotion on, we're going to do what first? Warm it up. And then after we apply it, we're going to wipe up the excess. All basins are cleaned the same way. We simply rinse it, dry it, and store it. Use some paper towels to put it away. Okay. If you have to disinfect, the process allows for that to happen. And then we have, well, I don't have shoe rules up here. We did learn about shoe rules. If the patient's feet hit the floor, we got to talk about their shoes. Are slipper socks ever enough? No. We're going to learn the rest of shoe rules today. And then we have the closing. What kind of environment does the patient need to be in? Clean and safe, right. So if it's safe, what position does that bed need to be in? The lowest. What about the head of the bed? Does that matter? No, it's their preference, absolutely. So we want to evaluate preferences as well. And one of the ways we're going to do that is by offering a magazine. Yeah, absolutely. They also need to hear a word. What word do they need to hear? Are you comfortable? We have to give them something. What are we giving them? Yeah, call light. Absolutely. You also want to make sure that they're covered. Remember, exposure is important here. So make sure that they're covered. And then once we have done all of that, we can open the curtain. Yeah. And after we've done all of that, how do we get rid of those cooties? Wash our hands. Now, if we have to document, do we document before we wash our hands? After. But then, because our cardinal rule is in skill with clean hands, if you document, what do you have to do? Wash your hands again. Look at how much you've learned. Guys, in 2 weeks. 2 weeks. And you've learned all of that. You just proved it. Now, don't tell me you're not ready for the test. You got it. Now you got to put it into practice. Sure. But you can also practice on people at home. Find a live human. Practice on them. You've got your book that gives you step-by-step instructions. But you also have this room available to you until 4. So you can come in here and practice as well. But practice at this point really does become the name of the game. We've got so much more to learn today. We have 4 skills that we're going to learn. Before I jump into those, let's review what we've learned so far for skills, just to keep it fresh in our mind, okay? So when we're taking the pulse, what do we always need to support? The arm, the wrist. Specifically, what needs to be on the bed? Elbow. Pulses are reported over what time frame? 1 full minute. You can take shortcuts as long as care plan doesn't tell you otherwise, but 1 full minute is what they're reported over. What is a normal pulse rate? 60 to 100. What fingers do we want to use? Yeah, index and middle. What part of the fingers? The fingertips. What finger can we not use? Thumb. All right. And where is that pulse located, that radial pulse located? On the thumb side of the bendy part of the wrist. Very good. Very good. When we're counting with evaluators, how do they know when to start and stop counting? Yeah, you got to say it out loud. And then because you counted something, what do you have to do with that number? Document it. So dressing a resident, we're going to ask them about clothing, preferences, choices, enter your word here. Ask them what they want to wear. Sure. When do we want to get the clothing? Before or after we undress them? Before. We want to minimize exposure here. We're lifting all extremities from above or below? Below, and we want to support at the joints. Remember to support at the joints. How do we remember which arm is undressed first? USA first. Undressed strong arm first. Which arm gets dressed first? Weak arm. Yeah, absolutely. We don't want to overextend or force movement. Remember, don't break their ankle. And we want to adjust the clothing for neatness and appearance. Remember that. Always adjust that clothing. Make sure it's good. Where do all the items that we took off of the patient and off of the bed go? In the hamper. Don't leave them on the table, the floor, the bed. You got to get your work environment clean. Believe it or not, and this really surprises me. It really does. During testing, the amount of people that will leave dirty items on the bed or on the table and say, my skill is done. It's actually very surprising to me that they end the skill that way. So like they would dress the resident, but they'd leave the patient in bed with a privacy blanket on, the patient gown on the table, the barrier on the table, everything there. They would just dress the resident and then say, okay, I'm done. That's like half of the checklist you've missed. Because cleanup is just as important as doing the skill. Remember, patients rest better in a clean environment, right? So that's the reason these rules exist. And then those same people will say, well, I wouldn't do that in a clinical setting. Come on. Well, this is a clinical setting. This is your patient. You're going to treat this patient just like you treat every patient out there. So we have to remember that the testing process is a true indicator of how you would do this skill on a real patient in a real setting. So I know I go over this a lot, but it's important because it surprises me just how many people miss it. Okay. You guys won't. I mean, you're all sitting there rolling your eyes going, well, duh. But you're saying duh because I've drilled it into you. Okay. All right. And which hand should we put that call light in? The stronger hand. Absolutely. Hand and nail care. We're going to support that wrist and arm at all times. We're going to soak the hand in water. Whatever we wash, whatever we rinse, we dry. And that hand, should it be put on the table? On a towel. Soft surface. Very good. What part of the orange stick are we going to use to clean under the nails? Yeah, the beveled edge or slanted edge. Yep. And when we use the orange stick, what do we have to do before when we go between nails? Wipe it off. Emery board is going to file in what direction? One direction toward the middle, toward the center. Very good. And then we apply lotion last. That's a little more important than you guys think it is. It's actually a little more important than you think it is. And that's because when you use the emery board, you're actually causing little tiny micro bits of the nail to fly. Okay. And if you, just by filing, have you ever filed your nails and then felt the gritty, right? Well, if you put lotion on first, that holds all of that grit right up next to the hand. Okay. It's actually better after you file to wipe the hand off with a towel and then put lotion on. It's not a tested checkpoint, so it's not up here, but they do have apply lotion last as a checkpoint, and that's why. All right, making an occupied bed. This is easy. We just change that bottom sheet a half at a time, but we have a way to remember this. Clean rolls toward, dirty rolls away. Yeah. So to do this, if we're going to change that bottom sheet a half at a time, what position does our patient need to be in? On their back or on their side? Side. So if they're on their side, where do they need to be in the bed on their side? In the middle of the bed. Sure. Absolutely. And remember, we always remain behind the patient's behind. Yeah. Yep. What do we need to try to remove from the bed, from the sheet when we're putting the bottom sheet on? Wrinkles. Yeah. And you want to look for any foreign objects as well. But definitely try to get that sheet as wrinkle-free as you can. You're not going to get perfect. There's a body in the bed. We're not going to get military bounce a quarter off of it perfect. But we can do the best we can. No big rat's nests. We do want to make sure that we're making those hospital corners to keep the edges of the sheet off the floor. Remember, nothing can touch the floor. We want to loosen the sheet over their toes, give them some wiggle room. And we want the pillowcase, after we replace it, to face which direction? Away from the door. Good. Side lying position, we're going to scoot the patient toward us. Furthest arm goes, closest arm crosses, closest knee is bent with the foot flat on the bed, and furthest knee is angled out. When you do that, it's easy to just roll them on their side. Super quick and easy. And then we're going to use some pillows. We'll put one behind the back in a roll, one between the legs, one under that top arm, and adjust the pillow under their head. Call light should always be placed in the bottom hand. That way the cord does not go over the neck. Okay. Foot care, just like hand and nail care, a little lower and nothing with the toenails. So we're going to have the patient check the water temperature. We're going to soak the foot, take it out of the basin, and support it. Remember, we always support as we move. And where should we put that foot after we take it out of the water? On a towel, whatever we're going to, once we get it on the towel, we're going to wash it. Then we're going to put it back in the basin too. And then we're going to take it out to dry. We'll apply lotion to all surfaces except where? Except between the toes. That's right. And when we put lotion on, what do? Wipe it off. That's super important with the feet, by the way. Your foot can slip inside a sock. It is possible. We don't want that to happen. So we always want to remove the excess lotion. And then we'll put the patient's shoe and sock back on. But why are we doing this? Why are we doing foot care? Is it really to clean the foot? It's to look at it. So we want to say something during the skill like, I'm looking at the foot. Be obvious. You can also say, I don't see any red areas or irritated areas or sores. You can say, I'm observing for any abnormality. You can say it any way you want to, but I like simple. Simple is best. I'm looking at the foot. Works fine. And in a clinical setting, I actually say that. I'm looking at your foot. Because who does that foot belong to? Don't they deserve to know why we're doing this? Okay. Wouldn't they feel better knowing somebody is, they can't look at the bottom of their feet anymore. They're not bendy. Wouldn't it make them feel better to know that, hey, somebody is looking to catch areas of concern early? So yeah, everything that I teach you guys, I do with real people. This is not a theory exercise for me. Everything that I do in here, when I'm working with real patients in a real setting, I do it exactly the same way. So don't let all those CNAs out there tell you, oh, you can't do that. That takes too long. No, it doesn't. No, it doesn't. and it's the right way to do it. Remember, patients are a partner in their healthcare. They're not there for you to do stuff to, they're there for you to do stuff with. Make them a partner. So I'm obvious about this. Yeah, I'm looking at your foot. Looks good. Mouth care. And remember, you're not going to brush everybody's teeth. If they can brush their own, we'll bring everything they need and let them do the honor. They're going to do their own mouth care. But if they can't, we're going to do a good job. Good job here. Okay. So what position does your patient need to be in for mouth care? Sitting all the way up. We want to protect that clothing. How are we going to do that? Towel, sure. What do you need to do with a toothbrush before you put toothpaste on it? Wet it. Yep, wet it. And then you're going to brush whatever the patient's got. Front, back, top, bottom, tongue. And then after we brush, what do we need to let them do? Rinse and spit as often as they need to. If you use a lot of toothpaste, you're going to be there a while. Use a little toothpaste. This goes easier for your patient. Little dab is fine. After you let them rinse and spit, what do you need to do before you go empty your basin and clean it out? Your patient just rinsed and spit. Yeah, we need to address this because they've got all kinds of toothpaste and saliva and water and gunk all around them. Do you think they want to sit there like that when you go over to the sink? They look like a rabid dog. They know that, and it's uncomfortable. So wipe their mouth off before you leave the bedside. Think about yourself. How would you want to be treated there? Respirations. Don't tell your patient you're counting them. That's important because it alters their breathing. How long do we count for? 1 full minute for the test, but as long as care plan says, really. If the care plan doesn't tell us 1 full minute, we can do the whole shortcut thing, 15 seconds, and multiply that by 4 to get a minute. What is our normal value for respirations? 60 to 100 is pulse. 12 to 20 is respirations. Very good. 12 to 20 is respirations. And just like pulse, we have to tell our evaluators start and stop, so we're all counting at the same time. In and out is counted as 1 full cycle. Remember, it doesn't matter where you start. If you start on an exhale, it counts. And since we're counting something, what do we have to do at the end? Document. Sure, absolutely. It's important to know why we're doing range of motion. As CNAs, we do range of motion to retain, not regain function. So there's 3 exercises here that we can do. There's flexion extension, which is an up down. There's abduction adduction, which is a side to side. And then there's rotation, which is around. That's right. And anytime we lift an extremity, we lift it from above or below? Below, supporting at the joints. Very good. All right. So any questions on what we've gone over so far? Any questions? All right, let's learn another range of motion. So let's go to page 80 in your book. So if you look at this, along the side here, it tells us the principles that are involved in this skill. They're detailed here to the side. So skill rules apply, opening, glove rules, range of motion, and closing. Nothing new to learn. We already know all of these. Nothing new to learn here. There's a video on this. Down here is test-specific information, and your short form, your notes are up there. So nothing new to learn here, just skill specific. If you look at page 81, you can see the care plan at the top of the page. Care plan tells us to provide the following range of motion exercise to the resident's right hip, knee, and ankle. Flexion extension. Now, you just told me flexion extension was an up-down motion. So we're going to move the hip and knee up, down, and the ankle up, down. It tells us provide 3 repetitions. So we're going to do each of those exercises 3 times. And the resident's not able to help with exercises, so we're going to do all the work. So as long as we follow that recipe, we can't get this wrong. Okay. This is a short skill, only 22 steps. Super quick and easy. In fact, the test says somebody with your level of experience should be able to do this skill in 4 minutes or less. 4 minutes or less. The hip is a 2-for-1 exercise. This is one of my favorite skills because it is short. It is easy. If I were to pick my skills for the state exam, this would be top of my list. Absolutely. So hip and knee works together. And the reason for this, we're going to bend the hip and the knee at the same time. So when we do this, we bring the knee up to the chest like you're walking upstairs. Okay. See how it bends the knee and it also bends the hip, right? There's a reason for that. You don't want to do these separately. And the reason for that has to do with this. These are nerves. Remember we talked about nerves when we talked about diabetes? Remember that? We're going to look at the nerves in the lower body specifically here, though. So this is your spinal cord here, followed, or, surrounded by your spine. And if you notice, these nerves come out from below your pelvic bone and they extend down your butt, down the back of your legs, through your knees, and down to your feet. Notice that they're already pretty tight. Okay? Not a lot of slack here. Nothing droopy. They're tight. That's important. Okay? Because if we lift the leg, straight leg, if we lift that leg up, what we call a straight leg raise, it's going forward. What's going to happen to this nerve if we lift the leg forward? It pulls it tight. That's right. Now, remember I told you guys that as we age, we get less bendy. You guys remember that? That's not just your muscles. It's also your nerves. Yeah, there's not as much slack here. It's not as elastic. So when we try to do something like this, when we have a patient laying down and we try to lift their leg in a straight leg raise, it can cause a lot of pain in that nerve by pulling it tight. And that pain can last for hours to days. It's called sciatica. It's very painful. So we don't want to do this. Let's go back here. By doing this, okay, think of that nerve in there. That nerve is actually having slack when we do it this way. It's not drawing that nerve tight. Does that make sense? This is why the hip is a 2-for-1 exercise. So we're going to bend the knee up to the chest and back down to the bed 3 times, but it's going to get both of those joints. Then we're going to move down to that ankle, and we just want to move the foot forward and back to move that ankle through a range of motion. But if we do that, if the patient's foot is on the bed and we bend the foot back and forward, what is that heel going to do against the sheet? Yeah, and that can cause a friction burn, or if we have fragile skin, remember our older patients have fragile skin, it can actually tear the skin. So when we're going to bend the foot forward and back, what we want to do is lift that ankle off of the bed a little bit to bend the foot forward and back, and that's what you see here. Good? So all we got to do here is follow the care plan. Super simple. Super simple. So provide the following range of motion, exercise to the resident's right hip, knee, and ankle, flexion, extension. Provide 3 repetitions, and the patient's not able to help. Remember that our care plan for range of motion is going to tell us which body part, which exercises, and how many repetitions. As long as you follow that recipe, your cake will come out fine every time. Remember that every skill starts with the opening. We have to evaluate if we need gloves. We're going to follow our range of motion specific steps. We'll move slowly and smoothly, return all the way to start. Flexion extension is up, down. And we're going to ask about pain and discomfort. Then we'll do the closing. Guys, the majority of this skill is the opening and the closing. The skill itself, pretty quick. All right, so let me get a volunteer, somebody to come over here and lay in this bed for me. And I will show you this skill. I'm going to ask you to just come sit in her chair for just a second. Are you in the middle? Good. All right, here we go. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you?
Good.
I am fantastic. I need to do some exercises on your right leg. Is that okay?
Yes.
I'm going to close the curtain. Let me go wash my hands, get my supplies. I'll be right back. Now, for the sake of time today, I'm just going to simulate hand washing. I've washed my hands. So now I'm going to come over here. I'm going to do all the work. Just let me know if you have any pain or discomfort as we do this, okay? So I'm going to lift your leg up, bend your knee to the chest, and back down to the bed like you're climbing upstairs. Remember, I'll do all the work. So under the knee, under the heel, just relax for me. Relax. There we go. Bend up and all the way back down. Feel okay? We're going to go up, all the way back down. Still good? One more. Up, all the way back down. Still good? Okay, now I'm going to move down to your ankle. I'm going to lift your foot off the bed just a little bit. We're going to bend the foot forward and back to the head. You'll feel a little stretch. Okay, so I'm going to lift. Relax for me. Forward, back. 1, forward, back. 2, forward, back. 3. Feel okay? Are you comfortable? Is there anything else I can get for you while I'm here? Would you like a magazine before I go? Environment is clean. Open the curtain. Here's your call light. If you need anything at all, just hit that red button. Bed is in the low position. I'm going to go wash my hands, think about my skill, make any corrections, and tell the evaluator my skill is done. Thank you. You guys notice that most of that skill is the opening and the closing. This is why I tell you in week 1 to learn that opening and closing really well, because we're going to be using it over and over and over and over again. In fact, I dreamed about the opening and closing last night. All right. Questions? Okay, so let's go to page 96. Now let's talk about dentures. Yay, dentures. Okay, so again, not much new here to learn. We've already learned the principles. So we know how to do skill rules, right? We know how to do the opening. We know to evaluate if we need gloves. Spoiler alert, you need gloves for this one. We know to use a barrier on the table. We know how to utilize linen rules. We don't hold linens against us. We make sure that we discard anything we don't use. We don't put dirty linens on the floor, you know, those types of things. We know how to clean our basin, and we know how to do the closing. Nothing really new to learn here other than our skill-specific steps. We have a video for this. Here's your short form steps. And then along the bottom, you can see test-specific information. So when you're looking at this, You can see that this should take somebody with your level of experience 13 minutes or less to do. This will be done on a live testing student. I know, let's stop there because everybody starts to freak out here. I don't have dentures. It's fine. You don't need them. When we go look at the care plan in just a minute, it's going to say that our patient already has their dentures out and sitting in a denture cup. Okay? So because the patient has already removed their dentures, we don't need you to wear them for the test. Good? But let's get to the care plan here, and let me show you. Let's go up to the care plan, top page 97. This care plan says a resident with dentures is sitting at an overbed table with their dentures in a denture cup. The resident's denture needs to be brushed with toothpaste, and the resident needs mouth care. So this is an important step, that the resident needs mouth care. We're going to come back to this in just a second. The denture is stored in a denture cup after cleaning, and the resident is not able to provide their own mouth care or denture care. Now, let me explain to you why this is important. Dentures are usually held in with denture paste, which is gummy, sticky, stringy, and that's going to hold food particles right up against the gums. If nobody is cleaning that denture paste off with those food particles, those food particles are going to decay, and they'll actually eat into the gums. How gross is that? So when you are cleaning dentures, don't forget we have to clean the mouth those dentures came out of. That's a really important part of denture care. A lot of times your patient can do this themselves, but sometimes they can't. And if they can't, our care plan will tell us that the patient is going to need mouth care. Don't skip that part. Okay. I actually had, when I was a hospice nurse, I actually had a patient that this affected, and it was truly horrible. This is probably one of the worst cases I've ever seen of neglect. This person had dementia. She was in a assisted living facility, and she had some other issues that had degraded her health. She couldn't really do her own mouth care anymore. She could put her dentures in, she could take them out. She remembered that part, but she couldn't like clean her mouth very well. Well, the CNAs would clean the dentures. They would put them in the little cup with the fizzy tablets and rinse them off the next day, no big deal. But nobody ever cleaned her mouth. And she had dementia, and she was nonverbal. So what had happened was way up here at the very, very back of her cheek area, the back of the top of her gum, way up here, she was pocketing food. And that food was held right up against her gum. And that food decayed and actually ate into her gum. Well, right above that are your sinuses. And that hole that occurred actually went into her sinuses, and it wasn't caught. Now, she was running fever. She was had foul breath. I mean, but nobody ever checked it out. Like the symptoms were there, but nobody was like reporting it. Nobody was telling anybody that this was going on. Well, eventually that she stopped eating, by the way. Nobody reported that either. So she started dropping weight. Well, that intrusion into her sinuses actually penetrated into the brain and caused a brain abscess. All because nobody did mouth care. How horrible is that? It ultimately killed her. That's bad. So when your patient, this is why Skill Rules says we report all observations, because we had a lot of opportunities here that were missed along the way. That's sad. Very sad. We can do better than that, I think. Okay. So when we're doing Denture Care, don't forget the mouth that those dentures came out of also needs to be addressed. Okay. So let's talk about dentures. So CNAs clean both dentures and we do mouth care as well. But when we talk about dentures, there's a little bit of information I need to give you because most people aren't really familiar with dentures, don't really know how they work. So let me go through this with you. I mean, we know they're fake teeth, yes. We do know that. All right, where's my denture brush? All right, so when we are working with dentures, can you hand me that box of gloves behind you, please? Anytime, thank you. Anytime you are going to touch dentures, you need gloves on. This is for your protection as well as the dentures because we don't know what you've touched. Those dentures are going to go into their mouth. And the mouth, as we know, is a portal of entry. So if we're going to touch dentures, we need some gloves. Now, when we're talking about dentures, you probably think of this. This is a denture, okay? This is a full plate. This is a top plate because it has this part that goes up against the palate, the roof of the mouth. This is a top plate. But all of the teeth have been replaced. This is not the only kind of denture there is. We can also have this. This is a partial. This is a bottom plate. Notice it doesn't have the part in the middle like this does. The part in the middle goes against the palate. If it's got a cutout, it's probably where the tongue goes. Not always. They are now making top plates that are just horseshoes like this. But if you notice, this has a bunch of holes. That's because this patient still has some healthy teeth. And we don't pull teeth that are healthy. We just do partials around those teeth. So you might have a full plate. You might have a partial. Or in some cases, we can have this, which is a little piece of a denture, just filling in one or two teeth that are missing. These tend to be, today, now, these tend to be permanently attached with posts, but you may still have removable bridges. They're all cleaned the same way. But a little piece of a denture is called a bridge. If we have cutouts for natural teeth, they're partials. And then full plates are dentures. Good. Dentures are always stored in water. And that's because the denture material will dry out and become brittle if it's not. We definitely don't want brittle dentures. Can you imagine biting down on something and have a denture break? That would be horrible. Just leave that there for now. So I don't need gloves to touch the denture cups, but I do need gloves to touch the dentures themselves. Keep that in mind. So this skill is going to require 2 sets of gloves. One to clean the dentures, and now those gloves are dirty. Do you think the patient wants those dirty gloves in their mouth? No, so we need a second set for mouth care. 2 sets of gloves for this one. So there's 2 ways of cleaning dentures. Probably the one that we're most familiar with is this one, the little denture tablets. You put the dentures in a cup of water, put a couple fizzy tablets in there. They fizz for a couple hours. It breaks down all of those proteins. And then you rinse them off, soft brush if you need for any bigger particles. And Now they're minty fresh and can go in the patient's mouth. It's great. And most of your patients are probably going to prefer this method for the most part, unless the care plan says otherwise. Some people still want dentures cleaned the old-fashioned way with a toothbrush, toothpaste, and a sink. And that's what our care plan is telling us to do. We're going to brush our dentures like we would brush teeth. Okay. To do that, we're going to use a very special brush. And that's a denture brush. That's this guy here. It's a double-sided toothbrush. But it's a special double-sided toothbrush. This side is narrow. It's going to go in the channel part of the dentures. It fits in that groove well. So if I show you this, this is just a denture simulator. These are real dentures. This is a simulator. But you can see this pretty easily. See that groove, right? This fits in that groove very well to clean. This doesn't clean as well. It's too big. It doesn't fit in that groove as well. This does. Got it? So this looks like a toothbrush, the bigger side. So we're going to use that on the tooth part of the dentures. When we're cleaning dentures, we're going to clean everything that's there. So you guys can take a look at those two things and pass them around. I'll bring it over here in a minute. Julia says, good morning. I have a question. I was applying for a PCA position and they told me since I'm 3 weeks into class, if I can get proof of being this far into class, I can get hired. Any suggestions? Julius, unfortunately, no, we're not really going to be able to help you with that because even though you're attending virtually, you're actually not part of the class. There's no way for me to verify how many are you. Wait, hold on. Before I say that, let me just make sure are you? Oh, you are. Okay. You are in the class. Okay. That becomes a little bit more problematic. Julius, call me after class. Call my number. Call me after class to talk about this. I know that you're enrolled in the class, and I know you're attending virtually. The problem is that I'm not getting your scores. I can't verify how much you're actually attending, so it's really hard for me to verify that. But call me after class, and we can discuss that. Anna says, on the state exam, we might have a question how to take the denture out and put it in the patient's mouth. Okay, we're going to talk about that in just 1 second, Anna. You're like 2 minutes ahead of me. This far ahead. All right. So when we are going to, when we clean the dentures, we're going to use the denture brush because it has 2 sides. When we're cleaning the patient's mouth, we can use a toothbrush. You can, just like you would brush teeth, right? You can wet it, put some toothpaste on it, and use it. The problem is, remember that these dentures are held in by denture paste, stringy, sticky, gummy. That denture paste is going to get all up in those bristles, and you're not at a sink to be able to rinse it out. So it's not going to be overly effective after a couple of, swipes, right? So because of that, because your patient isn't at the sink, we're going to use something a little different. We're going to use this. This is called an oral swab, or most of the time we call it a toothette. Okay. And it's spongy, soft, but more importantly, it has 4 distinct sides to it, and it's solid. So this will swipe away the denture paste, and then you can turn it, and now you've got another area to work on. And you can swipe another area and turn it, and swipe another area and turn it. So if you think about the mouth in 4 quadrants, 1, 2, 3, 4, this works really well, and it's disposable at the end. So this is called a toothette, and we use this when we're doing the denture part. Or the mouth care part of the dentures. Now, one thing that I want to tell you about dentures themselves is that CNAs don't take them out and we don't put them in. Your patient has to be able to do that themselves. There's two really big problems with trying to take dentures out and putting them in another person. If I have dentures in and I want to remove them, I've got to take my fingers way back here at the very back of the jawline, and I've got to pop those dentures up and forward to get them to loosen up from my jaw. Now, my leverage won't have me put too much pressure on my lower jaw because I've got the right leverage for this. But if I reach into your mouth and try to pop dentures up, what happens are these two knuckles right here have to press down for my fingertips to press up. So when I do that, those knuckles pushing on your lower jaw can dislocate your jaw. So we don't take dentures out. Not our job. The patient has to be able to do that themselves. We also don't put dentures in because when you put dentures in, it's an automatic reflex to bite down to seat those dentures. Well, if your fingers are there, you know what's going to happen? You're going to get bit. And the patient doesn't mean to do it. It's a reflex. You put dentures in, they bite down to seat them. So we don't put dentures in. We don't take dentures out. So what if the patient can't do that themselves? Well, then we don't use their dentures. We puree their food. So we chop it up really fine so they don't have to chew. It's called a mechanical soft or a pureed diet. You'll see it both ways. So before we go to the sink and before we put on our gloves, we want to prepare that toothbrush to clean the dentures. So we're going to wet it. We're going to put toothpaste on both sides. And then we're just going to store it in that little emesis basin, the kidney-shaped basin, the one that looks like this. Okay. We're just going to wet the denture brush, put toothpaste on both sides, and store it in here. Now, we have to have a place to put that brush because we're going to take it over to the sink, and that sink is not clean. We don't want to just lay it on the side of the sink. So we want a clean place for that brush to live until we use it. Any questions on that so far? Any questions? Okay, so the basin's going to hold the denture brush until you get ready to actually perform the skill. You don't want that denture brush on the side of the sink. The sink is not clean. We do want to put a washcloth in the bottom of the sink. This is relatively important because those dentures are going to get really slippery when you start brushing them with toothpaste. And if you drop them and they hit the bottom of the sink, they're likely to break. By putting a washcloth in the bottom of the sink, we're creating a soft surface for them to land on. But even better, if you can get that washcloth over the drain, that lets water pool up. And if the dentures fall, they're not going to fall onto the sink. They'll fall onto the water, which will slow their descent, less likely to break. Now, we don't want to put the dentures directly in the sink if we can help it. That's not really clean. We really want to hold them in our hands. But if they should fall, we want a safe place for them to land. Of course, we always use paper towel, turn that faucet on once our hands are clean, but we're definitely going to use cold water this time, not warm. There's a principle that says heat coagulates protein, which means nothing to you. What it really means is that food particles have proteins, saliva has proteins, the sticky stuff that we use to hold the dentures in have proteins. And if you use hot water, it's going to make all of that protein stickier and harder to remove. So we want cold water here. Make it easy. Cold water, not hot. Of course, we want to wear gloves when we're handling the dentures. You can handle the denture cup without gloves. That's fine. But we definitely want gloves when we're handling dentures. And remember, the first thing your gloves should touch is or in this case, their teeth. All right, so we're going to brush everything. The palate, the gum groove, the teeth, the gum line. Don't drop those dentures. Don't set them down in the sink. Keep them in your hand over the sink. And When we're done, we're going to rinse out that denture cup, fill it up with cool water, and put the dentures inside. Then you turn the faucet off. Now, when you have this denture cup and you've rinsed it out and filled it up with water, you can hear the water. Okay. Dentures are rattling around in water. That's going to make this cup wet. I don't want wet cups on furniture. You'll ruin the furniture. So it warps. So what we're going to do is take a paper towel as a coaster underneath your denture cup. That keeps that wet cup from ruining the furniture. Housekeeping will not like you if you ruin their furniture. And you want housekeeping to like you, because when you need help, you want them to come. Okay. We'll wring that washcloth out, put it in dirty linen, and then we're going to take the basin holding our now used wet denture brush back over to the sink. Well, rinse the denture brush out, but it's now wet in the basin. We're going to take it back over to the patient's table because I need that basin. Remember mouth care? They had to spit in the basin. I need that basin. So I'm going to take the brush out, put it on the side, and take those gloves off. I'm done with denture care. Now I'm going to get everything ready for mouth care. I'll put the towel over the patient, dip the toothette in water, put toothpaste on it, put it in that basin just to hold it, and then put my gloves on. So the one thing that I've gone through all of this with you now, but the one thing that I want to let you know is this seems to be the hardest skill for students to learn. There's a lot of steps to it. It's kind of like two parts of the skill. You clean the dentures, you clean the mouth. And that transition from cleaning the dentures to cleaning the mouth really messes you guys up. And I get it. I get it. The one thing that I want you to remember is none of that matters except our big neon checkpoint here is that we're not using the same gloves to clean the dentures and clean the mouth. As long as you change your gloves somewhere in there, they don't care where. Okay. I'm going to show you how it should be done. But if you get a little confused on this, it's okay. Just remember you can't use the same gloves. This is a hard skill for you guys to learn. I get it. So remember, when we put our gloves on, the first thing those gloves should touch is the patient. Now we'll just perform mouth care. Top, bottom, front, back, tongue. Leave our patient's mouth clean and dry. And then we'll clean everything up. Good? Okay. So this is where I'm going to go into sales mode for just a second. This is the practice kit. And I just took our sample one out. This is our practice kit, and we have this available for you. If you come in here, I have everything here. But for those of you who are joining virtually and those of you who can't come in and practice, this is going to be important to you. It has that denture simulator that's somewhere around here. It has that denture simulator in it with a denture brush, so you can practice this. It has a denture cup. It has a wash basin, a bedpan, soap, lotion, Gait Belt, emesis basin, food tray, urine bag, graduate container, gloves, all of the small things, the chucks, and a carrying bag. It has everything in it that you need to practice. So for you guys that are in my physical class, you guys, this thing is only $45.99 right now until you graduate. Once you're done with class, it goes up to $65.99. I want to make sure that you guys have everything you need to practice. Guys, that's my cost. That's what it costs me to put this kit together. So I'm not making any money off of you. This is how important I see practice. Okay. Good. All right. So let's, I'm just going to leave that up for right now. Let's watch the video for this, for denture care, and then we will take a quick break.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm doing good. How about yourself?
Wonderful. I need to do denture care on you. Is that okay?
Yes.
I'm going to take your dentures to the sink. I'm going to close the privacy curtain and wash my hands. I'll be right back.
Okay.
Okay, Mr. Jones. I'm going to place a barrier on the table so we have a clean area to place the clean supplies. And then I'll gather the supplies that I need. We'll need a cup of water, a toothette, a denture brush, toothpaste, a basin, a washcloth and a towel, and 2 sets of gloves. Okay, we're going to get the denture brush ready for use, so I'll wet it and apply a little bit of toothpaste to both sides. We'll allow the basin to hold that denture brush until we're ready to use it. I'll be right back, Mr. Jones. I'm going to go clean your dentures.
Okay.
Okay, Mr. Jones, I'm just going to set your dentures over here so that you have them if you should need them later.
Okay.
I'll place the denture brush on the barrier and now we'll remove these gloves. And we'll throw those away. Do you mind if I place a towel over your chest?
That's fine.
This will help keep your clothing clean.
Thank you.
We're going to prepare for the mouth care portion of this skill. We'll take the toothette and wet it. Apply a little bit of toothpaste to one area of the toothette and apply gloves. Okay, Mr. Jones, I'm going to brush all surfaces of your teeth now. So in a moment, I'll need you to open your mouth wide so that I can reach the back teeth.
Okay.
Okay, can you open your mouth? Thank you. I'm going to brush the back on the bottom and on the top, both sides. Okay, can you bring your teeth together, please? Thank you very much. We're going to throw the toothette away. And would you like to rinse? Very good. Would you like another rinse?
Yes, please.
Another rinse?
No, thank you.
Okay. I'm going to remove your towel and we'll place this in dirty linen. We'll throw away the disposables. And now I'm going to clean your basin. I'll be right back.
Okay.
I'll place the denture brush and the toothpaste in the basin and open the drawer with a paper towel to store the basin and other supplies. I'll remove the barrier from the table and we'll throw this away as well. Now I can remove my gloves. Mr. Jones, are you comfortable?
Yes, ma'am.
Can I get you a magazine?
No, thank you.
Is there anything else that you need?
No, thank you.
Your call light's right there. If you should need anything, just let me know. I'm going to open your curtain and go wash my hands.
Thank you.
After washing my hands, I'll think about the steps of my skill, make any corrections, and then tell the evaluator my skill is done. Okay, so two things real quick. I've got this comment that says, can you place a paper towel on the bottom of the sink when cleaning the dentures? And this one that says, what is the reason for placing the washcloth in the sink? So the answer to that is no, you really shouldn't use a paper towel because it's just not thick enough to provide any protection if the denture should fall. And that's the whole reason for the washcloth, is to provide a softer surface for that denture to land if it should fall. So that's why we use the washcloth, and no, you really shouldn't use a paper towel, it's just not thick enough. But then I've got this comment as well, and it says, I practice this skill on my patient. After you finish denture cleaning and remove your gloves, do you wash your hands before doing mouth care? Now the answer to this is you can. If you want to, that's fine. There's no problem with it. But it's the same patient. So remember that cooties belong to that patient. So it's their mouth, their dentures. So same cooties, same source. So it's not required to wash your hands when you change gloves there. Okay? You can if you want to, though. There's no problem with that. Good? Does anybody have any questions on those two skills? All right, we're going to take a break. The next two skills that we learned today, I have a lot to tell you about each one of them. So it's going to take me a little bit longer to go over. So let's take a break, come back at 5 till. Get some blood flowing to your brain because we got some stuff to go over. Okay. Oh, why doesn't that work?
be done. Because if you have to go to work early, then can't be here. Did you go and do the,
Yeah, I'm gonna do it the last Monday.
oh, it's the last Monday?
It's next Monday.
Yeah.
Oh, it's Saturday?
The last Saturday? And it's on the boss.
Let's see.
So is it the first?
For some reason, I thought it was that Monday. She said at 2:00.
So I think it'll be the 18th, I think, or the 25th.
Okay.
I mean, it does.
Where is it? Right here, Saturday of the first week, class at 9 a.m. On Monday of the last week at 2 p.m.
It was Monday?
Yeah, because I already put it down.
Okay, so it's the 27th? $45, yeah, so
Well,
we're
was this the last Monday?
Yeah, so last Monday at 2:00. So we have
Last
class.
Monday is the 20th. So we're the 20th.
Yeah.
Who's gonna take it off?
Are you guys staying to breakfast today?
I can't. I gotta go fix my coat.
You just saying?
I think so. Just breakfast.
Yeah.
I mean, I don't know, I may have to tell my boss that I could just have Mondays and Wednesdays off, because that would help me, then I can stay.
Yeah, I'm going this week and next week.
Yeah. Has anybody stayed?
Well, it starts today. Everybody's staying because last 2 weeks she said that there was just so much information that
Oh,
she was
yeah,
reading.
we didn't get to stay.
Yeah.
Did you get your packet to, you know,
I don't think she got it. She wasn't here.
Packet for,
It's the packet to it's the this one.
no, I didn't get it.
yeah, you should have.
Okay. So that's registered for the test?
Yes.
And then you're probably missing your review things too.
Do you have your level 2 background check?
No.
No. Yeah, I don't either. So you have to set that up. And once you have that set up, then you can they'll send their information to whatever testing site you go to. So basically, you should get your background check like this week or next.
Did you do your net?
I'm probably gonna do mine tomorrow.
Yeah.
Where are you gonna go?
She said there's like a UPS place
Oh,
up here
Berkeley.
in Berkeley. I'll go there.
It's probably better off going in there than doing it online, even though it's
She
it's
said
$20
it's
more.
20, yeah, I'm probably just gonna, because it's same day of payment, she said. So
You're
you
gonna have
could
to,
pay and then go right after, I mean, right after you pay.
go up online.
Because it's same day appointment, so they, you know, pay at, 12 o'clock, and then at 1 o'clock, you can just go, right then and there. But I think I called and they said they won't do it Thursdays.
So,
And you know, so they will do it.
we'll get my review sheet.
Yeah.
Only because we could have some yesterday.
Can you hear that now?
No, I gotta do it. I just was weak. I'm just trying to have one weakness, so I didn't get the test right. But now she's saying that you should.
Yeah,
So I guess that's gonna change that.
yeah.
I was gonna do it like next week.
I was too. I was gonna wait and I was like, I'm just for the interest to get it done with, so we have everything instead of
I'm not there for you. Is she ready to get it over with? Oh, see, perfect. Did she check off your stuff? Like where you gotta go?
No.
Where do you live, Springfield?
Yeah.
Probably all the same, right? I didn't bring that. I left it at home on the counter.
So UPS, Berkeley.
Yeah. Or you could do it online and then you got to still go to UPS.
Yeah. So she said to, on the first page, where it says important, to put a star,
Mhm.
and then on page 2, it's gonna ask you if you have felony or yes or no, and A, B, C, D, E below, and then 2 for yes or no. A felony.
Oh, no.
And why did you put yes or no?
Oh, yeah, I know.
And just leave the A, B, C, D alone.
So if you get answer yes to it. Oh, okay. Are you staying last Monday? Next Monday?
Page 3, have you ever been competing from the Florida Medical Program? So you just put number 3,
Oh. Okay, yep, I see it. Okay.
and then number 4, basically the same indicator.
Yeah, I can see my. Basically, go now. Or you skip.
Did you do it for us?
Yeah, and then just skip.
And then you go to the bottom, and you drop those 2 boxes.
Are you mailing yours in or are you doing it online? For after you do your background?
Well, the background's gonna be sent to whatever
Yeah.
location.
And then I'm talking about
Yeah.
for you taking the test.
Yes, you have to, I think, bring it in by the beginning that day.
And
I think you have to bring this paper when you go to do the exam.
oh, you do? You still have to do it so you
It's got 2, this and got 2,
she went over it so fast, guys. I don't know.
So I need to watch the video again.
I'm gonna have to do, because
Well,
if you do it online, you're gonna have it, but if you mail it in, you can do it either way.
yeah, that's,
Yeah,
that part I'm not sure.
yeah, that's the confusing part.
So if you go to page 5, you're going to check on the living body, clinical skills, and written vocal English.
Oh, this one here.
Spanish.
Oh, so it'd be this one, the top one.
Yes, unless the bottom one, the computer's gonna speak to you if you want that one underneath it.
Oh, okay.
So if you want the computer to speak to you, then you can click on
Yeah.
And it tells you where the testing, where you gotta put it to. Did you do that on there? Where you take your test, and you should tell us the closest one.
Yes, the closest one is going to be up here, Tampa Bay Airport. So,
You should check with Mommy was checked off. I wish I brought mine.
No, it doesn't. And so these are all the places, but really, I mean, this place is not that far.
We hit it different people.
Oh, you're at Fusion.
Yeah,
Oh,
okay, so you do that, right?
I didn't look at the other side.
I'm like, I wish I brought it.
Oh, Tallahassee is too far. Yeah, these are all way too far. Oh, this one here, right? Is this one?
Yeah. This is a page that she actually.
You could do that one, or you could do university waters.
I mean, you know, this park is not that far away.
We'll just have to see, where we live out, which was probably say waters.
Probably.
Because
That's crazy.
that's gonna be,
That's gonna be really nuts. Oh, it's nice to know they have a nursing academy here. And they decided to live over this. Probably these three would be.
Give that just a little break.
Yeah, she does.
Okay, so let's go to page 63 and talk about energy conservation. Okay, so we have talked up until now about the process of aging and how it affects every single body part that we have. And part of what it's going to affect are our muscles and our bones and our strength and our stamina. But I want to spend a little bit of time specifically on this one topic because I think it's important that you understand this because it's going to affect how you relate to your patients. It's also going to affect how we do our skills. So we're going to spend a little bit of time on something called energy conservation. And I have a whole lesson. Sorry, guys. I have a whole lesson on this on page 63. So you guys can follow along. But there we go. But this kind of requires that we go back in time actually, in order to understand this. Have you ever seen a 2-year-old? Cute little guys. I love 2-year-olds. They're amazing. They're learning about the world around them. Of course, we already know no is their favorite word. But 2-year-olds will jump up and down for no reason. They just have excess energy. And they will jump up and down for no reason at all, just because they have energy. When was the last time you jumped up and down for no reason? Probably when you were 2. So what we need to understand is our energy levels peak out right in that time frame. That is the most energy you will ever have in your entire life. And I'm going to prove it to you. Let's go out to 12. Now, 12-year-olds still have a ton of energy. They can skateboard, play basketball, pizza parties, the whole 9 yards. But you put that 12-year-old in charge of a 2-year-old for an afternoon, who wins? 2-year-old every time. That 12-year-old will be like, Mom, can you tell them to go somewhere? Can you tell them to leave me alone? Right? Your energy level has dropped in that time frame. So let's go out to 22. Now, 22-year-olds will shop till you drop and go out at night looking fabulous, right? But you don't have the same energy level you had when you were 12. Let's go out to 42. 42-year-olds are shopping till they drop, but that's like 3 and we're not going out tonight. Let's go out to 62. 62, we're thinking about retirement now. We're putting our feet up for 10 minutes before we make dinner. There's just not enough energy to do our work activities and our home activities. We're starting to wind down a little bit. So if we think about how energy levels decline over our lifespan, what do you think they're going to be like at 82? This big. Now, let's go back to the 2-year-old thing for a second. Have you ever tried to explain to a 2-year-old that you don't have the energy they have? You ever tried to explain that? Like, I'm sorry, I can't play right now. I can't run around the yard. I don't have that kind of energy. Do they ever get it? No, they have no frame of reference. All they know is what they've experienced. And to them, everybody has the same energy level that they do because they don't know any different. They have no frame of reference, no experience. Does that make sense? Now, think about where you are on this energy graph. Okay. That 82-year-old telling you, I don't have the energy for that. Think about where you are on this energy graph. You don't have that level of experience. You don't have that frame of reference. So it's just like trying to tell a 2-year-old, I don't have that energy. You aren't going to get it. You're not. That 2-year-old may know, hey, yeah, you're old, but they don't understand the lack of energy. Make sense? So when you're caring for an older person and they say, I don't have the energy for a shower, where are you on this graph? You've got way more energy than they do. That's where you're coming from. Your response to them saying that they don't have the energy for something is probably going to be something like this. What do you mean you don't have the energy? I'm doing all the work. All you got to do is sit there. If they only have this much energy to get through the day, let's think about what takes energy from that. What are some things that you do every day that require energy? Oh man, that takes half of my energy every day right there. I like my bed. Absolutely. Me getting out of bed, half of my energy. 100%. So what else do we do that takes energy? Walk, sure. Walking, moving takes energy. What else? Eating. If you've ever been too tired to do something, it takes energy. Have you ever been too tired to eat? Have you ever been too tired to talk? Have you ever been too tired to get dressed? Have you ever been snuggled up in your bed, super comfy, and all of a sudden you got to pee? Have you ever been too tired to get up and go pee? Okay, all of those things take energy. But even things that we aren't thinking about, like breathing. Breathing takes energy. Think about somebody with a severe cold or asthma, how much they have to struggle to breathe. Breathing takes energy. Even normal breathing does. What about digesting your food? That takes energy. What about producing heat to keep our bodies at 98.6 degrees? That takes energy. So, wait a minute. Let's look at this real quick. How much energy do our 82-year-olds have? And what do they have to do with that energy? Everything. Now, we're not even talking about going to work, doing laundry, cooking, cleaning. We're not talking about that. This is just to survive. This is just to survive. They've got this much energy, and it takes all of this energy just to survive. And you come along and say, you want your shower, and they say, oh, no, I don't have the energy for that. Remember, you're thinking about this from a different viewpoint. You've got energy, and you're thinking to yourself, all you have to do is sit there, but that's not all they have to do. Are you starting to see that you're looking at this from two totally different viewpoints? Okay. We have to be sensitive to our older patients' needs. You do not have the same energy level that they do. Now, this is kind of important for us to understand because we're going to be working with primarily older people. And we need to have an awareness of this. And we also have to think about what we can do to help conserve some of their energy for bigger activities. And that's what we're going to talk about now. But we also have to be supportive along the way. And that's a really big part of this, is being supportive. Okay, good? Makes sense? All right. So when we have, now remember when I'm using generalities here, I'm not talking about all old people. Okay. We have some older people living across the street in Timber Pines. There's, I don't know, something like 10,000 retirees across the street in Timber Pines. They drive their little golf carts all over. They play tennis and bridge and golf and go to country clubs. And, you know, they're good. They're good. But those aren't really the ones we're helping, are they? Because they don't need our help. So we have to remember the ones that we are helping are the ones that have no energy. If they had energy, they would be driving golf carts, playing golf. So we have to understand that our population that we're helping is a little bit different category than just your general run-of-the-mill. But even your general run-of-the-mill is starting to slow down a little bit. Good? Makes sense? All right. So where this gets us into trouble is that we assume the patient has more energy than they do. So let's say that we have somebody who has a decrease in energy and they get up in the morning, they get help to the bathroom, they get dressed, they go to the dining room and eat. They come back from breakfast, they lay down for a few minutes to rest a little bit. They go to an activity, then they go to lunch, then they might lay down for a few minutes in the afternoon, and then they get up again. And in the meantime, you've got toileting in there about every hour and a half, 2 hours. And then they go to dinner. and maybe do some socialization after dinner, and then they get ready for bed, right? So a lot of things going on in there, and that's just a normal day, nothing out of the ordinary. But a lot of things require energy: getting up out of bed, getting groomed, getting dressed, toileting, meals. All of those things take energy. Socialization takes a lot of energy. And if you don't think socialization is important, let me tell you, it is probably one of the most important daily activities for an older adult. Otherwise, they start to feel isolated, withdrawn, depressed, and that can start a downward cycle. So, socialization is actually very important for your older individuals. If you've got an older individual in your life, make sure you are socializing them. Make sure you call grandma or Aunt Margie every once in a while. Make sure somebody is socializing with them. But if we have all of these things that are going on, by the end of the day, your patient might be out of energy, and then they may not eat dinner very well. That's actually pretty common with our older, and we as younger people tend to eat our biggest meal later in the day, dinner time. But as we age, it's often more difficult to digest large meals later in the day. And you often don't have enough energy to eat a large meal late in the day. So, with your older individuals, a lot of times your bigger meal will be at lunchtime and then just a little something in the evening. So, understand that even the way they eat is going to be different. Are you starting to see that older individuals are kind of like from Mars or something? They don't follow the rules that we do. But if they don't eat well, if we aren't doing what we can to conserve their energy and they don't eat well, what's going to happen to tomorrow's energy levels? They're going to be lower. Absolutely. And that can start this downward spiral where your patient just isn't able to get back to the energy level that they had before. So protecting their energy is actually a really big part of what we do. So how do we do that? Well, for some patients, it's going to mean grouping activities and times that they have more energy. I am not a morning person. No one has ever accused me of being a morning person, ever. And I hope to set that record through my entire life. Now, some of you are. Some of you are. My friend and next door neighbor, she gets up at 3:30, 4 o'clock every morning. I think she's insane. Me, I'll sleep till 9 o'clock if you let me. She thinks I'm insane because those are the best hours to work for her. She is bright-eyed and bushy-tailed. Not me. I work best somewhere between 4 and 10 at night. That's when I am most productive. Okay. We're all a little different, aren't we? So if you get me up at 4 o'clock in the morning and tell me that I need to get a shower, you probably ought to duck because I'm probably going to throw something at you. Not really on my schedule, right? I don't have the energy at 4 a.m. for something that ambitious. Now, you try to shower her at 9 o'clock at night, you probably ought to duck because she'll throw something at you because that's not where she is most active. That's not where her energy levels peak. Are you starting to see there should be some individuality worked into these schedules? We can't just say, okay, everybody is going to get showered at 3 a.m. That doesn't work for everybody. We have to take their individual energy levels into account. Does that make sense? This is what part of the care plan should be focusing on, is the individuality of each patient. Now, I know that we have schedules to run on in healthcare. You know, we can't always comply with everybody's preferences, but we should at least try where we can. And we should definitely understand that if we're asking a patient, do you want to shower? And they say no, it may not be the right time in the day for them. Good. So when patients refuse, when patients say no, you probably ought to gather a little more information. like Mr. McGillicuddy is refusing his shower again. And you come to me and you tell me Mr. M isn't getting a shower. I'm probably going to ask, why? Why? What's going on? And he says he's too tired again. He hasn't had a shower in like 3 weeks, and the man really needs one. So somewhere along the way, somebody should be asking him, hey, when do you normally shower? Like before you came here, when do you normally shower? Are you a morning? Are you an afternoon? Are you a once a week guy? I mean, when do you what's your normal schedule? If he's a once a week guy and we're trying to get him showered 3 times a week, he's going to refuse quite a few of those because he's a once a week guy. And yes, they do exist. Absolutely. It's their preference. Good, makes sense? So we kind of have to dig a little deeper. But if we can do little things to help our patients conserve energy along the way, it might actually make them more likely to agree with us when we ask them to do things. Things like helping them to stand up if they have limited strength. So there is a balance between strength and effort. Okay. So if you look at this like a seesaw, okay, right now, you are pretty much in balance. Okay. Strength and effort go hand in hand. But as our strength decreases, strength over here, as strength decreases, what happens to effort? It goes up. So we know that strength decreases as we age, right? Our muscles get weaker, they atrophy, so they get smaller in size. That means if we are losing strength, the amount of effort it takes to do tasks is going to increase. Make sense? So the simple act of getting out of a chair is actually going to take more energy for an older person than it does for you. Now, what do we know about their energy levels? They're low. So if we have somebody like me, okay, and I'm older, I might get out of a chair something like this. Scoot forward because my feet don't hit the floor. Okay, so I might, as an older individual, get out of a chair something like this. Have you ever seen this? Right? Working my way up, get my feet in place, and then I'm going to try to, nope. How much energy did that take? A lot, right? Rocking takes energy. Standing up and falling back takes energy. Getting up finally takes energy. All of those things take energy. Now, you guys, when you get out of a chair, you just stand up, right? That didn't take any energy. You don't even think about it. No energy at all to you. But as we age and our strength goes down, that effort has to increase. That's going to use up more energy. Remember, we've only got this much. So if we can use tools to help our patients stand up on the first try, that saves some of their energy to maybe eat lunch or shower or go to activities or even socialize. Because remember, socialization is an important part of your daily activity. Are you starting to see where this can really be a big deal in our patients? So that's what this skill that we're about to learn is all about. This skill is all about learning how to help your patients conserve energy. And we're going to do that by using a gait belt. Turn this back on. So if you look at page 66 in your skills book, if you look at page 66 in your skills book, it tells you on Ambulate with a Gait Belt, all of the principles involved. So we know to follow the care plan. We know to do the opening. We know to evaluate if we need gloves. We know some shoe rules. We're about to learn the rest of them. And we know the closing. We need to learn skill specific. And we have to go over a few new things with shoe rules that we haven't gotten to yet. Test specific information is here at the bottom. This says somebody with your level of experience should be able to walk somebody at least 10 steps within 5 minutes. Way more time than you need, guys. This is going to be done on a live testing student. They're going to be sitting in a chair. You've got your synopsis or short form steps there, and I do have a video for that as well. Oh. Who gave me a thumbs down? That's sad. Okay. So we need to learn shoe rules in order to learn how to do this effectively. Page 67 at the top of the page. Young girl says, what is the duration given by the state after classes to take the exam? Depends on what state you're in. Usually it's set actually by the schools, not the state, but it really depends on what state you're in. Generally speaking, you should be taking the test within 6 months of graduating because otherwise you're going to forget what you've learned. And in most states, I won't say every, but most states, your school is actually graded on your performance. It's called a pass rate. And if your school has a low pass rate, they get penalized. And they can actually get their license to teach CNA revoked. So they're very interested in whether you pass or not. If you wait 2 years to take the test, your chances of passing are pretty low. That reflects on the school. So the schools are the ones that usually set that time requirement. DJ says, hi, Miss Patty. This is Edward. Oh, awesome, Edward. I just passed my CNA exam last Friday. Oh, congratulations. Awesome. He was in my last CPR class too. Great job. Super proud. Okay, so if we look at the care plan at the top here, it says ambulate the resident at least 10 steps. Use a gait belt or transfer belt. That's what this is. Patient will be sitting in chair with shoes on. Patient is able to walk but needs assistance to stand. So just what I showed you a minute ago, somebody that requires a lot of effort to stand up. We want to try to conserve that effort by using a gait belt. So we're going to learn how to use a gait belt. Step-by-step instructions are here. They're going to go over onto page 68 as well. Supplies are pretty easy for this skill. You'll see, does it go over to 68 or does it? No, okay, I'm sorry, it ends. Oh yeah, it ends, I'm sorry, it ends here. My skill's done. Your questions are on page 68. So here's your supplies. You need a gait belt. Patient needs shoes. And for the skill, for the test, it says that they're sitting in a chair with their shoes already on, okay? But that doesn't mean that we aren't going to acknowledge them. So for the test, remember if the patient's feet hit the floor, we got to talk about their shoes. So we're going to say, I see you have shoes on. Or are your shoes fastened appropriately? Or do your shoes fit well? We need to address those shoes in some way. Make sense? Okay. But there's a couple of rules here that we have to go over, and they're all safety rules. So we know the first two. We've been over that. We talked about that with diabetes. Let's start 3 down. We need 4 fingers between the gait belt and the patient. You want to make sure this is snug enough around their waist that it's not going to move, but you don't want it too snug that it interferes with breathing. And the way we check that is with 4 fingers. So this is a gait belt. It's just a flat canvas belt with a metal buckle. This can go on this way with a buckle facing this direction, or it can go on this way with a buckle facing this direction. Nobody cares. No right way, no wrong way. As long as the tag is inside, like every other article of clothing. When you put this on the patient, it goes around the patient's waist, not yours. And when you put it on, you want to make sure it doesn't twist. You need the belt flat. So the reason that I say that is because a couple of years ago, we had somebody testing when we were testing center, and they had no idea how to use this at all. So the first thing they did is put it around their waist and had the patient hold on to it as they were trying to stand. Then they realized that probably wasn't helpful. So they took it off and they put it on around the patient's chest and started pulling this way. And the patient was, they realized that probably wasn't good. So then they stood the patient up and they tried to put this around both of them. It was the weirdest thing. And it wouldn't fit. So I'm not real sure what goes through people's minds when it comes to the gait belt, but it goes around the patient's waist. So when you put this on, don't have it twisted. It needs to be flat. It goes around their waist. So if I turn around, you'll see that it's flat. When you put this around the patient's waist, you're going to put the free end through the first guard by the alligator teeth, just like that. And we're going to pull it the direction the teeth point. And we're going to keep pulling. This is too loose. We're going to keep pulling, still too loose. And we're going to keep pulling. And we're going to check it with 4 fingers. As long as we can fit 4 fingers between the belt and the patient, it's good. You don't want it so tight that it interferes with breathing. Okay, this is not comfortable. But you also don't want it so loose that it slips up as you're trying to stand the patient and goes underneath the breasts or underneath the arms, or the patient just slides out of it completely. So we want it snug so it stays in place. We're going to check it with 4 fingers. Once we get it snug enough, we put the free end through the second guard. The second guard. And that locks it into place. This tail hanging down might get in your way. Just tuck it up in the belt. That's all we have to do. Now this is ready to lift the patient to a standing position and provide a little stability while we're walking. So to lift the patient using this belt, you don't want to grab from the front, sides, or back. Okay. To remove the gait belt, we're going to take it out of the second guard and we're going to hold that tail in our hand. We're going to take our other hand and grab the buckle and slide the buckle along the tail. When we remove it, you don't want to slide it against the skin. Listen to this. You hear that? That can cause a burn. It can tear the skin. So we never pull it against the skin. You want to reach behind and grab both sides, or you can loop it up and over. Just be careful not to let this hit their head. So you want this secured. Good? Pretty easy, right? Pretty easy. So that's how to use a gait belt. Now, I'm not keeping up on my slides here. Hold on. So just a reminder, slipper socks are not enough. We have to talk about their feet. This is applying the gait belt. Remember that the tag is in the inside, and we're going to check it with 4 fingers. So this is something that gets missed a lot. Let me bring this over here and back it up. Just because somebody is sitting in a chair does not mean that their feet are flat on the floor. My hips are against the back of the chair, but if you looked at my feet from the side, they are not flat on the floor. And that's because I have short legs. Every part of me is short. My husband talks about my pterodactyl arms. They're short. So if you're going to walk somebody and you're going to stand them up using a gait belt and their feet are in this position, what do you think is going to happen as you pull them forward? Yeah, they're going to fall. They're going to be off balance because they're trying to balance on their tippy toes. So it's your responsibility to make sure that your patient's feet are flat on the floor before you stand them. And it's just as simple as asking them to scoot forward so that their feet are flat on the floor. Once their feet are flat on the floor, now we have to talk body mechanics. So we get their feet flat on the floor. We make sure they have shoes on. We put the gait belt and check it with 4 fingers. And now we are going to lift them, but we have to think about body mechanics. And when it comes to body mechanics, we want to make them a partner in what we do. That way we're working together. It's not you versus me. It's both of us versus gravity. So when we're going to lift somebody to a standing position or transfer somebody or do anything with their body, we want to count to 3. 1, 2, 3. That makes them a partner before we lift. This is important because if the patient isn't expecting it, they're not going to engage their muscles to help you out. It does say our patient can stand with support, or I'm sorry, it says the patient can walk but needs assistance to stand. So we know their muscles work, but we need them engaged. So we're going to count. And then we're going to stand at what we call an oblique angle. And this, for those of you who know body mechanics, is going to be a little change from what you've learned previously. We don't stand right in front of somebody when we're lifting them. If I'm sitting in this chair and somebody is standing right in front of me and lifting me toward them, my entire body weight is pushing them backward. So this is what it looks like from your standpoint as the CNA. If you're standing in front of somebody and you're bending at the knees and you have your hands around the back, remember we're grabbing the sides or the back, your hands are around the back. As you lift them forward, their whole body weight is coming toward you and your back is going to go backwards in response. This is physics. There's no way around this. Every action has an equal and opposite reaction. You did learn that in high school. Whether you remember it or not, you did learn it. So every action has an equal and opposite reaction. So equal means their body weight. My back is going the opposite direction in response to their body weight. So if I'm lifting somebody 150 pounds, that means that there's 150 pounds of force pushing me backwards. My back has to accommodate that. This is how we blow out our backs as CNAs. Back injuries, number one reason CNAs leave the industry. So standing in front of somebody, not a good body mechanics option. What we're going to do instead is use something called an oblique angle. And you can see that here. So again, if I'm, go back here. If I'm sitting in this chair, you can see a line in front of my feet and line on each side. Think of it like a box, okay? So what I want to do is stand at the corner of that box. One foot is going to go across their feet, perpendicular, keeps their feet from sliding out. The other foot goes parallel to the chair. So I'm standing at the corner of the box, 1 foot along each side. Then I'm going to bend at the knees, never at the waist. That's how we blow out our back. So I'm going to bend at the knees. I'm going to reach around behind the patient, grab that gait belt, and on the count of 3, 1, 2, 3, we're going to stand. And when I do that, it keeps the patient's body weight from affecting my center of gravity, my balance. Okay? Do you see her arm placement, the patient's arm placement there? That's actually going to be important. If you look, so I'm just going to borrow your book here. If you look on page 61 at the top of the second column, you can see a picture there of somebody without good body mechanics. When their arms are at their sides and you're pulling at their center, it's leading with their center. So their top half and their bottom half are offset. This is not good body mechanics for your patient. When you ask them to just place their arms on your shoulders, not around your neck, not holding on, just rest your hands on my shoulders, that moves them as a unit. Nothing drags behind. Okay. So let me go back. So the patient's hands resting on your shoulders is actually a pretty important step to keep our patients moving as a unit. Once we get our patient standing up, we want to ask, are you dizzy? Here. Don't wait until you get way over here. You get way over here and you say, hey, are you dizzy? And they say yes. What's your exit strategy? What are you going to do about it? Now, what most of you will do about it is, oh no, you're dizzy? Let's hurry back to the chair. All right, if your patient wasn't tolerating a slow walk, what makes you think they're going to tolerate a hurry? You're not going to make it. That patient is going to fall halfway. That is not a good strategy. So asking them while they're at the chair, way better strategy. You feeling okay? Everything good? If they say, no, I'm a little dizzy, a little woozy, a little nauseous, have a seat. We're not going anywhere. Great exit strategy. And then who do we tell? Nurse. But let's say that the patient stands up, says, no, I'm fine, I'm good. And we get halfway down the hallway, and now all of a sudden, things have gone really wrong. And your patient will always tell you. Patients don't just walk along, I'm good, everything's fine. Ugh. It doesn't work like that. Patients will let you know something is wrong. They get pale, they get sweaty, they put a hand out to the wall, they put a hand up here, they start to weave, they put a hand here, they slow down, they do all kinds. I mean, there's neon signs going off all over the place. Something is wrong. Your job is to pay attention to it. So the whole point of ambulating with a gait belt, what they're watching here is what you're watching. Who should the focus be on? The patient. If you're looking down the hallway, if you're checking your phone, if you're having a conversation and your focus is not on the patient, that's when we hear, oh, I don't know what happened. We were walking and all next thing I know, she's on the floor. Well, that means that you weren't watching the patient. Okay. Does that make sense? So if we're watching our patient and we're seeing these signs and something is going very wrong, what do we do about it? Well, what we're going to do is lower them to the floor. Doesn't matter where we are. Get them sitting on the floor. You can back them up to the wall and help them slide down the floor. If I'm walking, I'm holding the gait belt from behind with an underhand grip. We're walking along. I start to see something. My foot gets planted right in between theirs. My other hand grabs the gait belt and I'm holding them for stability. You okay? You all right? Can we get back to the room? No? All right, let's have a seat here. And I'm just going to pull them back and slide them right down my body to the floor. Patients that sit on the floor can't fall on the floor. Sitting doesn't break hips. And I've got soap that washes off whatever they came into contact with. Falling, you can't wash that off. Broken hips take a long time to mend. Make sense? Safety. We want to get that patient sitting on the floor. But the best thing to do is ask if they're dizzy when you stand them up, and that can help avoid a lot of that drama. When we return the patient to the chair and we turn them around, don't ask them to trust you. If I can't feel that chair behind me, I have no idea it's there. That means I have to trust that it's there. Do you think I trust you? No, I've probably been dropped 3 or 4 times already as a patient. By the way, that is the average. Yeah. Patients in long-term care settings are generally dropped 3 to 4 times. They don't trust you, and they shouldn't. So in order to know that chair is behind me, I've got to back up so that I can feel it with the backs of my knees. Now I know the chair is there, and I can easily sit. That's important. Good? So we want to use proper body mechanics. We're going to bend at the knees, not the waist. We're going to stand the patient up, ask if they're dizzy. We're going to let the patient lead, hold the back of the gait belt from an underhand grip. Pay attention to the patient the entire time. Ask if they're dizzy. As we're walking, when we return to the chair, we're going to make sure they can feel the chair behind them before we help them sit. Okay? Good? Questions? So like I said, this skill takes 5 minutes or less. Let's talk about this. Usually, in most cases, the evaluators are not going to throw you a curveball. except for this. They will do this. So when you start this skill, that evaluator is going to put something in your way on purpose. So it'd probably be one of those bedside tables, rolling tables. They're going to put something in your way. So when you start this skill, your evaluator is going to give you a destination. Care plan says at least 10 steps, but your evaluator is going to say, I want you to walk to the desk and back, or to the wall and back, or to the table and back. They're going to give you a destination, and they're going to make sure that you've got something in your way because they want to see if you're going to address it. You need to remove that obstacle before you stand the patient. You cannot leave that patient standing to get that obstacle out of the way. This is something that they're looking for. So you need to scan your environment, make sure there's nothing in the way. Okay. This is a curveball that they do use on the test, and it's important. Gait belts go over patient's clothing. I know I shouldn't have to tell you this, but there it is. This is an actual testing checkpoint. That's how important this is, or actually, that's how often this wasn't performed, that it's now a checkpoint. I don't want to know how this was done previously. Make sure that gait belt is over the clothing. We're going to hold the gait belt around the back and sides to lift, not the front, and make sure that their arms are on your shoulders. Let your patient lead, and pay attention to the patient, walking slightly behind into one side. Ask them frequently how they feel and help them sit using the gait belt. When we remove the gait belt, oh, thank you. Awesome. When we remove the gait belt, we'll make sure that the patient is seated properly and do our closing. So not bad. This is actually a really easy skill. Really easy skill. So if I can get somebody to come sit here for me, I will show you what this skill looks like. All right, so the evaluator, when we set this up, the evaluator put this table in my way, and I was told to walk to the camera and back to the chair. That's my destination. Here we go. Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you? Fantastic. Do you feel like going for a little walk?
Absolutely.
We're just going to walk to the camera and back. Is that all right? Okay, I see you have shoes on. Let me go close the curtain, wash my hands, get my gait belt, and I'll be right back. Move this out of the way before I go. Oops. Hold on. I'm going to close the curtain first. My hands are clean. And I'm going to get my gait belt. Now, it doesn't matter when you address the shoes. You can do it during the opening. You can do it now. It doesn't matter when, but I see you have shoes on. Are your feet flat on the floor? Okay, I'm just going to place this gait belt around your waist and secure it. And this is going to help me to stand you up and provide a little stability as we walk. So I'll put it through the first guard by the alligator teeth. And we're going to snug it up so I can only fit 4 fingers. We'll lock it into place. Get the tail tucked so it's out of the way. Okay, you're going to place your hands on my shoulders. I'm going to go around your back and hold the gait belt. And on the count of 3, we're going to stand up. And we'll stand there for a second to make sure you're not dizzy, okay? All right, so 1 foot in front. Go ahead and put your hands up here. 1 foot here. 1, 2, 3. Feel okay?
Just fine.
Are you dizzy at all?
No, ma'am.
Okay, I'm going to let you relax. And when you are ready, I want you to walk toward the camera at your pace. Okay, now I'm holding the gait belt from the back. Okay, we'll go ahead and turn around. Now I want you to stop for a second so I can let them see something. Do you see how looser that is? You guys all saw me check 4 fingers, right? The reason is we get skinnier when we stand. This is why we want it snug when we're sitting. Go ahead and walk back to the chair at your pace. Very good. Are you dizzy at all?
Oh, man.
Okay, go ahead and turn around. And I want you to back up so that your legs feel that chair. And I'm going to help you sit. So you're going to put your hands on my shoulders one more time. And on the count of 3, we're going to sit. 1, 2, 3. Very good. Feel okay?
Yes, ma'am.
Okay, I'm just going to remove this gait belt. Very good. Is there anything else I can get for you while I'm here?
No, ma'am.
Are you comfortable?
Yes.
Would you like a magazine before I go?
Oh, thank you.
Okay, environment is clean. We're going to pretend he can reach the call light. Now, for the test, the chair would be right beside the bed, so you would be able to reach a call light. And here I bring it out just for visibility. Okay, so here's the call light. We'll pretend you can reach it. I'm going to go put my gait belt away. If you need anything at all, just use call light to let me know. So I'm going to open the curtain, put my gait belt away, wash my hands. After washing my hands, I'll read the care plan one more time. You can go ahead and have a seat. Make any corrections, and then tell the evaluator, my skill is done. Good? Questions on that one? That did not take 5 minutes. Might have taken 2. Maybe 3 if we stretched it. So you've got plenty of time. The reason that I bring this up is I do not want you rushing on the test. I want you to take the time to think all of these steps through. You've got plenty of time to make this happen. Don't rush. Okay. So before we get into this, I want to talk about, go to page 71 for me, since we're talking about timing. Page 71. Now, page 71 talks to you about skills timing, and there's a whole lesson. You guys can read that on your own. I want to do this quickly together so you can understand how much time you actually have to do the state exam. Okay? So for every skill that we've talked about so far, I've told you a time. You should be able to do denture care in 14 minutes or less. You should be able to ambulate somebody in 5 minutes or less. You should be able to do range of motion in 4 minutes or less, right? We've talked about that. Okay, so I want to show you how the test takes those times and comes up with your total testing allotted time. So there's a little bit of math here. Don't stress. It's easy math. So can you give me a number 1 to 11? 10. Oh, good. Right there. So the test, the computer randomly picked skill set 10 for you to perform on your exam. Okay. So our skills are, for skill set 10, our skills are measure and record pulse, perform passive range of motion to elbow and wrist, and provide a partial bed bath, which is the next skill we're going to do. Okay. So the evaluator is going to read that to you, and then they're going to hand it to you, but then they're going to tell you you have 36 minutes to perform these 3 skills. So let's figure out how they came up with that number. So on page 71, on page 71, in the first column, you see a graph that tells you how much time per skill. So if you look at that graph, how much time should you have to do a pulse? 5 minutes. Okay, so we're going to take 5 minutes. How much time for range of motion, elbow and wrist? 4 minutes. Should say range of motion all. 4 minutes. So 5 minutes for pulse, 4 minutes for range of motion. So now we're up to 9. Now, partial bed bath. How much time do we have for that? 19. So if we add 9 and 19, we get 28. Now, I told you have 36. So where does the rest of the time come from? Well, each skill has its own timing. So 5 minutes for pulse, 4 minutes for range of motion, 19 minutes for partial bed bath. But we're going to add to that 3 minutes for hand washing. So your hand washing doesn't even count in your skill time. They give you 3 minutes above and beyond for hand washing. So we had 28 plus 3 is 31. So where's the other 5 minutes come in? Well, you get 5 minutes for what we call transition time. I call it thinking time. It's the time in between each skill. It's thinking about the steps of your skill before you end the skill, reading the care plan, all of that other time. They're going to give you 5 whole minutes for that. So you get time for each one of the skills. You get extra 3 minutes for hand washing and then an extra 5 minutes for thinking. This is why I tell you don't rush. Rushing is what will get you in trouble. Now, if we have 36 minutes to do this skill set, when the clock hits 31 minutes, they're going to tell you 5-minute warning. Now, you know you've got 5 minutes left. Okay. Do you remember whoops. Ugh. Do you remember these guys that we've looked at along the way? Do you remember this? Right? Anything with red is the closing. How much red is on here? A lot, right? How much red is on here? A lot. So if you get a 5-minute warning, you probably ought to make sure that you get a closing done because that's where most of your checkpoints are coming in. Got it? So if you get a 5-minute warning, if you know the closing well, I can do a closing in 20 seconds. 20 seconds. I got a 5-minute warning. I know I only need 20 seconds to do my closing. That means I can get through as many steps as I can because if you time out, it's not an automatic fail. You just don't get credit for whatever you didn't get done. Okay? Does that make sense? So you really should know your closing well. So let's see how quick I can do the closing. Let's take a look here. We'll start timing when it gets to the 7. You guys ready? Thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Your environment is clean. Your bed's in low position and you're covered. Here's your call light. If you need anything, just press the red button. I'm going to go ahead and open your curtain and go wash my hands. I'll document if I need to and wash my hands again. Read the care plan and my skill is done. That got us 25 seconds and I did not rush. I did not rush. So if you know the closing and you know how many steps get us points on the closing, and you practice the closing so you can do it within 25 to 30 seconds. I can really do it in 20 if I go in speed mode, right? That leaves you 4.5 minutes to get whatever else checked you need to get checked off. Good? Good. That's where it's important that you know the steps. My students don't time out. You just don't. There's no need for you to. Good? Okay. Easy peasy. All right, so let's move on to partial bed bath. This is the longest skill we have. As we just learned, we have 19 minutes to do this skill. It's right here at the bottom of the page, 19 minutes. It's on page 126. And this skill uses almost every single principle we've learned so far. Almost every one. We're going to follow the care plan. We're going to do our opening. We're going to evaluate if we need gloves. Spoiler alert, you do. We're going to use a barrier. We'll use a privacy blanket. Linen rules apply. We want to make sure the patient's in the middle of the bed. It's a washing skill, and we have to clean that basin. And we're going to do the closing. So, man, there are a lot of steps here. But they give us 19 minutes to do it. And you get 2 super short skills to go with it. It's not a bad skill set to get, to be honest. Okay? But it is long. It is long. And there's a lot to do for this skill. You're washing half a body. Half a body? Oh, let's get there. Let's take a look. So if we look at the top of page 127, we have a care plan. That care plan says, give the resident a partial bed bath and a back rub. Wash the resident's face, neck, chest, abdomen, back, and one arm and hand with soap and water. Provide a brief back rub with lotion. Dress the resident in a clean hospital gown after bathing. And patient is lying on back in center of bed and can roll as directed, but is too weak to assist with bathing. So that's our care plan. So it tells us in detail exactly what to wash. But I'm going to make it easier for you. Right here. Face to waist, front and back, face first, no soap. We don't like to use soap on the face because it dries the skin, stings the eyes. So no soap on the face, just water. It's all we need there. And then we're going to do from the neck down, front and back, soap, rinse, dry. That's it. But it does tell us, though, one arm and hand. This is because of the evaluators. Where do they want to be? Home in their pool, drinking their Mai Tais, right? If they watch you wash, rinse, and dry one arm, they don't need to see it on the other side. They just don't need to see it. Now, I'm going to tell you this funny story. A couple of years ago, they tried to cut this down to half of the torso. But that caused a lot of confusions because students are like, well, the top half, the bottom half, the right half, the left half, that's what I don't know what to do here. So they left the torso and just did one arm and hand because it's a little bit easier for you guys to get. But it's not about, this has nothing to do with how clean you get the patient. That is not why we're doing this. Has nothing to do with this. You're going to get the patient clean because you're there. But that's not really why we're doing this. You're showing that you can do this while maintaining dignity and privacy and respect. You're showing that you know whatever you wash, you rinse. Whatever you rinse, you dry. That's what they're grading on here. Okay. You're also showing that you know how to wash without scrubbing off their skin. So gentle. Good? Make sense? Not a hard skill. Not a hard skill at all. But this is going to be done on a mannequin, a female mannequin. And since we're washing the torso, we're washing around the breasts. That is a bathing suit area. So what do we need? Gloves. Absolutely. Don't go near anyone's bathing suit areas without gloves. They might get the wrong impression. Okay. Good. We also are going to wash the face. Face first, no soap. We're going to wash the face. Now, when we wash the face, we know that on the face, there are doorways. Doorways let things in as well as out. So we want to be really careful in the way that we do this. Okay, the way that we wash the face. We're going to use a new cleaning technique. So this is finishing up our principal day. Okay. So we learned the rest of shoe rules. You guys remember that? And I remember on washing rules, there was one principle I didn't tell you about. One principle I didn't show you. I told you we'd get into that this week. This is the very last principle you have to learn. This is it. And then you've learned them all. I'm super excited. So remember that doorways let things out and in. So to do this skill, we are going to learn, drum roll, the leaves method. So this is the last principle that we have to learn. And to understand this, we need a washcloth. Just a plain old, boring, everyday washcloth. Oh, sorry. We're going to review the washing rules first. Okay, so what do we not add to the basin? Soap. What do we use to turn the water on? Paper towel. What kind of water do we use? Warm. Who else checks it? Patient. We change the water if it gets cold or soapy. And whatever we wash, whatever rinse, we dry. Dry surfaces need to remain dry. So, wring out your washcloths really well. No drippy, wet messes. And lotion is warmed and then wiped off. We already know that. So let's talk about the leaves method. Anytime we're going to be washing any wet body openings, and remember, we learned this, a wet body opening is eyes, nose, mouth, genitals, anal area, wounds, sores, rashes, and incisions. All of this is a wet body opening. And when we're doing partial bed bath, we're definitely around wet body openings. So if we're going to wash any wet body opening, we need a new special way of washing. So this is a plain square washcloth. Fold it in half and in half again. We probably have these in a linen closet at home somewhere. And we look at them like little squares that are folded. But instead of looking at it as a square, I want you to turn it a quarter turn and look at it as a diamond. If I put this diamond in the palm of my hand with the free ends pointing up, not the folded end, I want the free corners pointing up. I tuck this side in between my pinky and ring finger and this side in between my thumb and index finger. I'm going to use this to wipe something like an eye. And then I'm going to fold that over, which traps the contamination underneath and gives me a new clean area to work with. I wipe something with that. I fold that over, giving me a new clean area to work with. I wipe something with that, fold that over, giving me a new clean area to work with. I wipe something with that and fold it over, and that gives me another new clean area to work with. This is called the leaves method, and that's how it works. And you guys all get to play. So, you pass that back, please. Welcome. No, take one and pass one down, please. Okay. So we have a small square folded. You want to hold it so it's a diamond. Put it in the palm of your hand with the free ends facing up. Tuck one side between your pinky and ring finger, the other side between your thumb and index finger. So it should look like this. So we would wipe something, fold that over. Yep, good. Very good. Okay, wipe something else, fold that over. Wipe something else, fold that over. And I hold the folded ones with my thumb. Wipe something else and fold that over. And this is called the leaves method. And it prevents cross-contamination, which is really important. So let's look at the care plan again. It says give the resident a partial bed, bath, and back rub. Wash the face and wash the resident's face, neck, chest, abdomen, back, one arm and hand with soap and water. Provide a brief back rub with lotion. Guys, this isn't massage therapy. We don't deep tissue anything. We are just opening up capillaries to restore circulation and making the patient feel better. Back rubs used to be a really big part of what CNAs did because it makes you feel better. Think about when you were a kid, mom would come along, rub your back a little bit, and you always felt cared for, cared about. CNAs used to do this a lot. We've gotten away from it, but it is still important to make our patients feel cared about. So brief back rub from the bottom of the back, the base of the back, up to the shoulders, small circles 3 times. That's all we're doing here. Tells us to dress the resident in a hospital gown and patient is lying on his back in the center of the bed. Can roll as directed, but is too weak to assist with bathing. So if I have my washcloth, remember we're going to wash face first, no soap. So I'm going to hold my washcloth in the leaves method. I'm going to wash inner to outer corner of the eye, fold that over. And then I want to wash the other eye, inner to outer corner, and fold that over. Because if somebody has something in this eye, we don't want to transfer it to this one. But remember, this isn't just a doorway out, it's a doorway in. So we've got to be careful and make sure we're not contaminating. Then I'm going to use the third leaf there to wash the rest of the face. So the forehead, the cheeks, the chin, and, you know, around the mouth. And then I'm going to fold that over. And I always do the nose last. Boogers. I just don't want to spread them everywhere. So I do the nose last. Nobody cares. There's no checkpoint. Do this how you want. Eyes first, inner to outer corner, 1 leaf each. The rest of it, they don't care. Just wash the face. I do the nose last because I had kids. Boogers. Okay. Now we're going to wring this out really well. No drippy wet washcloths and no soap. So once we're done with the washcloth, we're going to come back with a towel and pat dry because whatever we rinse, we dry. I just said that. Okay, so then we're going to wash the rest of the body, and it doesn't matter how you do that. Nobody cares. Wash the body. Neck down to the waist. 1 arm and hand. I do armpit last. It's an armpit. Do it last. It's the stinky part. You don't want to hit an armpit and then the rest of the body, right? So do the armpit last. But this rule is the same rule we've heard with everything else. Support as you lift. Support the joints. We know this. There's nothing new here. Kind of easy. Everything with soap on it gets put back on the barrier after use. We don't reuse soapy washcloths. But you can reuse a rinsing washcloth if you want to. That's okay. But don't reuse anything we apply soap to. Now, that's important because a lot of times you're not going to have enough supplies, you know, because there are CNAs out there that hoard this stuff. They go in at the beginning of shift and they get all of the linens and take them to their rooms and they don't share with anybody. Well, that doesn't help all the patients. So you might be doing a lot with a little. So remember, you can reuse rinsing washcloths, but not soapy ones. Okay. We'll wash, rinse, and dry the back. Give a brief back rub with lotion for circulation and comfort. We always warm the lotion off first and wipe it off. And then we'll change the patient's gown. I'm going to show you a way of doing this that actually cuts about 2 minutes off. And the way that I do it is I change the gown as soon as I get the front of the patient clean. So I put the new gown on. Then when I turn the patient over to wash, rinse, dry the back, and give the back rub, all I have to do is tie that gown. It takes about 2 minutes off of the skill. Because otherwise, if you don't do it that way, if you wash the front turn them over, wash the back. You got to turn them back onto their back, put the new gown on, turn them back over to tie the gown, turn them back over. It's a lot of stress on your patient. How much energy do they have? Very little. And even though we're doing the work, it's still energy from them. So it saves them on energy, but it also cuts down on your time. So that's how you're going to see me do this. Doesn't matter for the test which way you do it. It's fine either way. Fine either way. Remember that we're going to use a barrier. We'll fill our basin, let the patient check the water. We're going to remove the gown and put a towel on the bed. We're going to use a privacy blanket. We'll put some gloves on. First thing your patient, the glove should touch is the patient. We're going to wipe the eyes from the inner to outer corner, 1 leaf per eye. Wash the rest of the face. Whatever we wash, we rinse. Whatever we rinse, we dry. And we'll wash the front, change the gown, turn the patient over, wash, rinse, and dry the back, give a little back rub, tie the gown, return the patient at the center of the bed, and then we're going to clean up and do our closing. Okay. You've got 19 minutes to get all of that done. Doesn't take that long. Doesn't take that long. All right, so let me show you the video for this. After the video, I'm going to give you your review sheets, and the rest of the class is practice. So you should have about 40 minutes of practice built into today. On Wednesday, you'll have about an hour. Next Monday, you'll have about an hour and a half of practice time in class. Okay. During practice time, for those of you joining remotely, I do sign off. We don't broadcast student practice, and that's for their safety and security and comfort, as well as yours. So you won't see the students practice, but that is what they're doing. If you're joining us remotely, you should also be practicing. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Good. I need to do partial bed bath. Is that okay? I'm going to close your curtain. Let me wash my hands, get my supplies, and I'll be right back. For this skill, I'm going to need a barrier for the table. This will give me a clean place to put my clean supplies. For this skill, I will need 4 washcloths, 2 towels, a clean gown, and a privacy blanket. It's a washing skill, so I will also need a basin, soap, and lotion. And I'll need a set of gloves. Miss Jones, let me go get some water. I'll be right back. Miss Jones, is this water appropriate temperature? Okay. And now I'm going to spread the privacy blanket out over you. This will help keep you warm and protect your privacy while we do this skill. I'm going to spread the blanket without snapping or shaking the blanket. And I'm going to pull your sheet down to about your waist. Okay, Miss Jones, I'm going to ask you to sit forward for me in just a moment so I can untie your gown. And I'm going to spread this towel out underneath you to keep your sheets dry while we bathe you. Can I assist you to sit up, please? Thank you. I'm going to untie your gown and spread the towel out on the bed. Go ahead and lay back down, Miss Jones. Thank you very much. And now I'm going to spread the towel out underneath the arm. I'll remove the gown on the side closest to me, supporting the elbow as I lift it. And I'm going to relocate the gown to the other side of the patient. This leaves the patient uncovered underneath the privacy blanket for bathing. The blanket will keep you warm. Now I can apply my gloves. I'll take the first washcloth and wring it out. And I'm going to use 4 corners. We'll wash the face first, no soap on the face. Ms. Jones, I'm going to wash your eyes. I'll start with the closest eye to me. I'm going to wash from the inner to outer corner. Very gently. And then we'll fold this sleeve over to prevent contamination from spreading to the other eye. Ms. Jones, I'm going to wash your other eye now, inner to outer corner. We'll fold that leaf over, and then I'm going to wash the remainder of the face. Using very gentle strokes and keeping control over the washcloth. We'll fold that leaf over and use the final washcloth for the nose. And then we'll set that aside. I'm going to take the towel and pat dry all areas of her face, making sure not to use too much force. We'll set the towel aside. We're going to take the second washcloth and wring it out. And we'll apply soap to the top leaf. We do not need to use the leaves method because all of her skin from this point is intact. We're going to wash behind the ear, under the chin, across the neck, the upper torso. We're going to lift the blanket to protect privacy but keep the patient covered while we wash down to the abdomen and up the side. Now for the exam, you are going to make sure the patient remains covered until the evaluators ask you to remove the blanket. At that point, you will just continue on. I am going to repeat these actions so that you can see what I have done. I'll remove the blanket for better visualization. Behind the ears, across the chin, the neck, the upper torso, around the breasts, down the abdomen, and up the side. Then we'll clean down the front of the arm, the hand, up the back of the arm, lifting at the elbow, and the armpit last. We'll set this washcloth aside because it has soap on it. We'll take the third washcloth in the basin and wring it out. And we're going to rinse all the areas that we just washed. So behind the ear, under the chin, across the neck, the upper torso, around the breasts, the abdomen, up the side, down the front of the arm, keeping the elbow supported on the bed. We'll rinse the hand, the back of the arm, and the armpit while supporting the arm. The rinse washcloth can go back in the basin for later use. Now we're going to dry all of those areas. So we're going to pat dry or use short, soft strokes, but nothing vigorous. ahead and lift your arm, Miss Jones. We'll set the towel aside. Now the patient has a clean torso, so we'll place the clean gown on her. Miss Jones, can you reach your arm through here? I'll help you put your gown on. We'll lift the arm at the elbow, supporting it as we lift. And we'll spread the gown out. Okay, Miss Jones, I'm going to go around to the other side of the bed now, and we'll dress the other arm. Since the care plan said that we only needed to wash one arm, we do not need to cleanse this other arm. That's per the care plan, but we do need to dress it. So I'll remove the soiled gown, and we're going to place this in dirty linen. And then I'll put the new gown on. Ms. Jones, can you reach through this armhole? Thank you. And go ahead and lift. Thank you. Okay, Ms. Jones, I'm going to ask you to turn onto your left side now. This is going to allow me to wash your back and give you a brief back rub. So I'm going to ask you to scoot toward me, and we're going to roll you onto your left side. Ready? Go ahead and scoot toward me. 1, 2, 3. Now the evaluator will hold the mannequin in place while you complete your cleaning. So I'm going to take the third washcloth, wring it out, and we'll soak the top leaf. I'm going to wash the back of the neck, the shoulders, and the back down to the waist. We'll set that washcloth aside. We'll take the final washcloth and wring it out. And we're going to rinse all of those areas. The back of the neck, the shoulders, and the back down to the waist. And then finally we'll dry all of those areas. The back of the neck and the shoulders, the back down to the waist. Now our care plan asks us to give the patient a brief back rub. So we're going to use a little bit of lotion, making sure to warm the lotion in our hands before we give them a back rub. Ms. Jones, I'm going to give you a little back rub now. I'm going to start at the small of your back and work my way up in small circles to your shoulders. We'll do this 3 times. This is for circulation purposes. 1, 2, one more, and 3. I'm going to wipe off the excess lotion. Now I can tie the patient's gown. And remove the towel that's protecting the linens. Ms. Jones, come on back onto your back, please. And scoot to the middle of the bed. Thank you. I do not want to touch that sheet that's going to go right up next to her face with soiled gloves, but I need my soiled gloves to take care of all of my dirty linens. Ms. Jones, I'll be right back. These items are going to go into dirty linen. Now I'm going to go clean the basin. I'll empty the basin and rinse it, and then pick it up with a paper towel. I'll dry the inside with one paper towel and throw it away, and then dry the outside with a paper towel and throw that away. And I'll get one for the drawer. I'll collect the soap and the lotion, placing them in the basin, and return the basin to its drawer for storage. Paper towels can be thrown away. This barrier is going to be discarded, and now I can remove my gloves. Okay, Ms. Jones, I'm going to remove your privacy blanket now and pull your sheet back up. Are you comfortable? Good. We're going to roll the privacy blanket in a ball so that the trailing edges don't contaminate other surfaces. This will be placed in dirty linen. Okay, Ms. Jones, is there anything else I can get for you while I'm here, such as a magazine? No? Okay, here's your call light. If you should need anything at all, please let me know. I'm going to open the privacy curtain and wash my hands. After washing my hands, I'll think about the steps of my skill, make any corrections, and tell the evaluator my skill is done. Okay. So we got a couple of comments here. It's these two came from Marie. It says, "Hi, Miss Patty, how are you? I just want to say thank you for your amazing works. I had decided to challenge the CNA state exam. Your videos were the only videos I watched. Your ebook was so helpful. I didn't have anybody to practice on. I memorized everything on my head step by step. I did my exam last week, Wednesday, and I passed both of my exams on the first try." So I want to point out a couple of things. Congratulations to you. Great job. I'm super proud. But I want to point out a couple of things. She did not sit in this class, did she? She didn't practice, did she? She just watched the videos and memorized, right? So what excuse do you guys have? Okay. So this is somebody who watched the videos and she did an awesome job. I'm super proud. I'm not minimizing your experience. But what I'm trying to tell you guys is that you are prepared. Okay? Good? Okay. All right. So, Manette, you're a good teacher. Keep it up. Oh, thank you, Manette. That's super sweet. Thank you. All right. So that will conclude today's lesson. Okay. So we've gone over everything that we needed to go over. I'm going to give you your review sheets for today. Those of you who are joining us virtually, you can access those exact same review sheets online, flcnatraining.com. You can get the review sheets. There's links there to everything that we offer, everything. The free ebook that she talked about, the personality quiz for workplaces, everything that we have is located on that page. So flcnatraining.com, you guys can go there as well. Is everybody getting my wrap-up emails? After class emails? Good. Okay. All right. So let me get you your review sheets. We're going to go ahead and sign off. Please make sure that you join us on Wednesday. We're going to be going over 3 additional skills on Wednesday, and then we have 1 week left after that. Crazy. And remember, my game show is next Tuesday, a week from tomorrow. So until next time, guys, happy caregiving. Bye.